Yes. Okay, so let's start. Gazuli, would you like to go?
ما تقول انت بقى.
خش انت الأول. Okay. Okay, perfect. So first thing, أول حاجة عايزين نعرفها. I'm gonna explain this part in Arabic, guys. If it's not clear,
ماشي،
anything
خليني هبدا
here.
انا محمد عادي، ما تقلقش، مش عشان عارف انت احنا كنا متفقين ان نبدا، اتس اوكي. ماشي. Okay, so in the OSCE exam, okay, guys, we have a lot of like factors that there are score depending on. Okay, for example, it's a little bit different from the MCQ. Here we mainly focusing on certain skills that I know that people got on past MCQ. Everybody knows that they're okay or 100% okay with the therapeutics and the therapeutic part of it, the theoretical part of it. Here in the OSCE, the main aim is to communicate your knowledge in a very simple language to your patient, to get the best. How can I put it? To put the care plan in the most benefit for your patient. As simple as that. So mainly the communication point of view here is the main issue. I know lots of you are very good in therapeutics, but it's not mandatory to communicate or to explain your therapeutics in a very simple language to be understood to your patient. Okay, that's the general idea. To divide the score on
It's all about information or knowledge communication here. Okay, it's all about that.
Exactly.
Okay.
Here we still there is some competencies that they have the spotlight on. For example, for like ethical and legal and professional responsibility, which account for 8%. Still, if you're going to dispense medication, you're going to do something, interact with the patient, it has to be under the umbrella of laws and legislation and ethics, and that's gonna be 8% of your mark. Patient care, which is it's like the information that you give to your patient. It's still that we can say the therapeutic part is still 42%, but as we can see here, 42% by itself cannot let you pass the exam. Okay, so it's the professional plan, the relationship between you and your patient, the care plan that you're going to put to your patient. You have to customize this care plan. We're all going to discuss and practice all this in the future. Okay, so patient care, it's going to contribute to 42% of your weighing score.
Yes.
Drug distribution.
خليني بس اقول الحته دي يا جزولي، يعني as we call patient care the jackpot here. عارفين الجاكبوت اللي هو اللي مش عارف اللي هي نصيب ولا مش عارف ايه. هي بالظبط كده الموضوع ده كده، الموضوع البيشنت كير هنا بالظبط هو ده الاوسكي من الاخر كده، وهو بينكلود كل الايتمز اللي موجوده تحت دي. اوكي، اهم حاجه how to obtain your information, the relevant information, not any information. اوكي، because لو انت جاي يعني لو سالت اي حد سؤال مش relevant للكيس you're gonna waste your time. ماشي، وهتضيع وقتك وهتضيع، وده كمان ممكن ينزل كمان من السكور بتاعك كمان. So here obtain relevant information about the patient. دي أهم خطوة في الموضوع، لازم تجمع كل المعلومات اللي أنت محتاجها. أوكي؟ هنا بتفرق من السيت اب بتاع الستيشن. If it's like a renewal medication أو أنت لسه new prescription، هنا لازم تبقى عارف أنت هتسأل على إيه. لو أنت البروفايل عندك والبيشنت البروفايل موجود عنده الالرجيز، ولو هي حامل ولا مش حامل والقصص دي كلها، خلاص it doesn't make sense to re-questioning، ان انت تسأل تاني مرة تانية، ده كده مش make sense، انت كده بتضيع وقتك يعني. فاهمين الفكرة هنا؟ بعد كده بتشوف بقى ال patient actual potential drug therapy problem لو في DTP ولا لا، ال professional relationship معاه طبعا الحاجات دي، ال monitor and assess therapeutic outcomes, one of the most important items and one of the most forgotten items here. الناس دايما بتنسى المونيتور والفولو اب والحاجات دي، ازاي تاسس البيشنت والفولو اب. موضوع الفولو اب ده مهم جدا 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 في الكلوزنج بتاع الستيشن. اوكي، الحته دي مهمه جدا. تمام، الفولو اب لازم الرابور، زي ما بنقول الرابور بينك وبين العيان كده في الاخر ده لازم تقفل بيه الستيشن. اوكي، عايز حاجه كله تمام خلاص هكلمك كمان يومين كمان 3 على حسب انت هتكلمه ليه. اوكي، هنشوف بالتفصيل في الاس او اس بالظبط الحاجات دي هنتكلم عليها، بس انا حبيت بس اهايلايت الحته دي لان البيشنت كير دي فعلا من الحاجات الجاك بوت بالظبط كده. اوكي، اتفضل يا جزولي معلش.
One of the most important competencies is drug distribution. What does it mean in drug distribution? It's the non-interactive stations. By the way, in the MCQ exam, they test the drug distribution in calculation. I don't think there is a calculation in the OSCE exams. So how they do it? How are they gonna test you in drug distribution? Do you want to make sure that when you dispense medication, you dispense it in a proper way? Okay. How they test you? How they test this competency by the non-interactive. You have to pass in the non-interactive to pass the exam. If you did 100% in the interactive and you didn't, and you fail in the non-interactive, that means that you fail in a competency. They're not going to let you pass the exam without passing the non-interactive. That's why so many people, like very good in communication, very like stunning, and they got stuck in the non-interactive because they don't have like an experience working in a pharmacy or something like that, or they run out of time. You're not going to pass it. Okay, and this happens so many times. So drug distribution, product distribution, or drug distribution is mainly the non-interactive station, and there are 2 non-interactive stations recently. Okay, you have to pass it by practice as much as you can, and we're gonna practice here, I believe. Practice setting is not assessed in the OSCE. Health promotion. Health promotion is sometimes they bring you. It's yeah, I know it's like 3%, but again, it's one of the main important competencies, specifically these days. For example, drug health promotion means sometimes they test it in a specific separate station. Like for example, they give you a station for a smoking cessation or a vaccine station. That's totally health promotion and communication. Okay, or during the exam within each station. How come? For example, they give you like an autoimmune disease, and they have in the check mark. If you didn't focus on at the end of your station, you focus on the vaccination, for example. So that means you didn't you ignored or you neglected the health promotion part in this station. Okay, so we're going to practice in this as well. It's 3%, but it still is one of the most important and forgotten competences. Knowledge and research application. It's your capability to go through the reference, or how confident you are when you check the references and stuff like this. Okay. The reference is not usual. Recently, they don't put a reference. Sometimes they put a study. Sometimes they put like a monograph. It's not like before. In the past, they usually put like a chapter or 2 from CPS or XTX or whatever. Now it's totally different. Communication and education, and that's 14%. It's the second biggest piece of cake we can say. Okay, the communication part. محمد عايز تقول حاجة؟
لا تمام، كنت عايز اقول بس حته الكوميونيكيشن والإديوكيشن دي بالظبط.
Yeah.
Second major competence in the OSCE exam.
Okay, so education and communication, it's your role in your daily basis work in the pharmacy. If you're a pharmacist, that's what you do the whole day. You're communicating to patient, trying to solve the problems, and you're educating patient. Okay. If you give the medication without educating patient how to maneuver the side effect, how to deal with it, how what's the one you're gonna expect, for example, when you're gonna expect like effect, the numbers, the targets. You cannot give a medication like, for example, blood pressure medication for a patient without telling him, okay, what's our cutoff point? Like 160 over 50, how over 95, for example, is it what is the difference between this number and 140 over 80? You have to put the cutoff point. That means education. Okay, what is needed from the medication, you have to tell your patient why we give you this medication. It's a part of like the patient feels that he is contributed his patient care, so it will build rapport. It will you will get higher marks in the patient care. That's how the assessors in the OSCE give you the mark. Okay, so education is very important. It's not like pushing medication and that's it. Just let him go, and without even him like know what's happening with this medication, what is expected with this medication. Okay, so that's very important too. Intra and interprofessional collaboration. It's either through a specific stations, like for example doctor station, nurse station for example, or within the station itself. Okay, wait a second, here there is a DTP, I'm gonna fax your doctor to change it. Okay, you have to change your we're gonna change it, and I'm gonna repeat it. I'm gonna and do this medication review. I'm giving you examples. Okay, I'm gonna fax your doctor with the results. This how they measure your skills in this competency. What else? Quality and safety is 5% of the scoring, and it ensures the quality and safety and the integrity of the product. It says create and maintain a working environment that promotes safety. In your, how can I explain this to you? As a pharmacist, you are responsible for the workflow in your pharmacy, and within the when to stop a medication, when to dispense it, when to say, okay, here there is a red flag, here there's an interaction here. All this workflow, they will know how confident you are within your communication to the patient while counseling, for example, while finding a DTP, while doing so and so. Okay, so that's within your contribution within towards the prescription that you get and you want to dispense it to the patients as well.
Okay.
Yeah.
Perfect. Okay.
حاجة
Good.
تانية يا محمد؟
To wrap up, no. عشان wrap up بص كل اللي احنا قلناه ده.
Okay.
Most important skill هي البيشنت كير. ايه البيشنت كير ده؟ زي ما قلنا كده، بتجمع الانفورميشن، بتكوميونيكيت النولج بتاعتك، بتعمل فولو اب، تعمل رابور ولا علاقه مع البيشنت، علاقه بروفيشنال. ذاتس ات. هو ده البيشنت كير بالظبط. دي طبعا النون فيربال كوميونيكيشن هنا دكاتره مهمه جدا في الجزء ده. بيشنت كير انت لازم بيتبص عليك في النون فيربال. تمام، اكيد انتوا اغلبكم عارف لو مش كلكم يعني. موضوع النون فيربال ده طول ما انت قاعد كده بتلاقي الاساسور بيبص في وشك كده، بيقعد يبص عليك، بيرمي عين كده ويرجع تاني للورقه بتاعته، للاسسمنت شيت بتاعه. اوكي، النون فيربال ده مهم جدا. تاني اهم سكيل هنا هي الكوميونيكيشن والاديوكيشن. اوكي، لو احنا وهي دي باختصار كده هم دول الاوسكي يعني، مع النون انتراكتيف بس كده خلاص. اوكي، كوميونيكيشن، education plus patient care plus non-interactive station which count under the product distribution skill or competency. Good. So far so good. طيب
دكتور
أي
معلش
أسئلة؟
دكتور معلش، حضرتك بتقول عن نون فيربال بيشوف ايه في وشي؟ يعني مش يعني بضحك مبسوط يعني
Sometimes there is some station it has two assessors. One of the assessor is responsible for your body language. For example, we had, for example, someone like one of the actors coming in, and this happened to me, coming in crying. Why she's crying? She has a miscarriage with a prescription of misoprostol. If you're smiling, that's a big red flag. You're not showing empathy. Okay.
أنا عايز أقول لك دي مشكلة كبيرة فعلا. أنا عايز أقول لكم
it's very and it's on daily basis, by the way. Sometimes because of that difference in the culture, he's meaning something and the patient is meaning really like a big issue, and you're taking it lightly, and you can lose a patient, and it happens. I saw it so many times, and I'm like, no, I'm not, and he can reply back with an aggressive or offensive way. Why are you laughing or why are you smiling? I'm in bad shape. So you have to take care of this important small stuff. Okay, for example, one of the stations, like, it's very popular station, I believe. A panicked patient come to you. I'm like, oh my God, I'm gonna die. The doctor told me I'm gonna die like in 10 years. Like in I know in the Middle East, when someone tells you something, okay, you're gonna die in the middle in 10 years. Okay, that's great. You may die tomorrow, and you start laughing. However, it's like it's a big issue, you know. It was, I believe, it's Framingham score kind of thing. So it Framingham. It's like it assess your death in 10 years and stuff. And he was like in bad shape. So yeah, you have to take care of this like things. Okay, so and that's very important because you can lose literally. You can be very good in therapeutic, and you can lose like your communication here is very bad.
It's not only in the OSCE, it's in the real life as well. انا فاكر موقف حصل لي برضه في الحاجات دي بصراحه، يعني اقتنعت ان هو النون فيربال كوميونيكيشن ده مهم جدا. كان جالي عيان مره، عارفين الاوتوكتون اللي هم الاب اوريجينالز، الجماعه الاب اوريجينالز،
فرنش بيبل،
فرنش بيبل الاب اوريجينالز دول.
مهم.
فجاي الراجل بقى وبتاع، انا بقى عادي، انا بقى جاي لي بقى اخر اليوم، انت فاهم، وانا جاي تعبان وبتاع، كنت اليوم ده كنت شغال يوم طويل شويه ومع الماسك وبتاع، فواقف بديله الكونسلنج، فباخد نفسي كده، عارف انت، بعمل كده، باخد نفس كده عشان الماسك خانقني وانا تعبان، فاهم. خلاص اديته الكونسلنج وزي الفل، والامور مشيت ومشى الحال. بس جيت بعد يومين ثلاثه كده برجع في الصيدليه، لقيت صاحب الصيدليه بيقول لي انت عملت ايه للعيان مش عارف ايه. قلت له ايه العيان مش عارف ايه؟ قال لي ده جاي وبتاع وبيقول الصيدلي اللي بينهج، يعني او مش عارف الحركه دي اسمها ايه، التنهيده، اللي بيتنهد. بيقول الصيدلي اللي بينهد. قلت له ايه الصيدلي اللي بينهد ده؟ فقال لي ده بيشتكيك، وبيقول له واحد في صيدلي هنا بينهد وبتاع وبيتنهد وبيعمل كذا، وهو بيبص لي، فعشان انا اوتوكتوني يعني وبتكلم فرنساوي، فهو مش عارف محتقرني ولا مش عارف حاجه كده، فاهم. فدخلني في قصه تانية بقى، وقصه راسيزم وحاجات كده فهي ده، بص، عشان عملت بس كده، انت فاهم. ففعلا in the real life هتلاقي الموضوع ده very considered، وبتلاقي عليه دايما في ايه سبوت، يعني زي ما بيقول جازولي كده، ما ينفعش تضحك واحده جايه تعبانه، ما تقدرش تضحك في وشها من باب ان انت عايز تتعاطف معاها مثلا. واحد مش عارف، الاب اوريجينالز دول بيبقوا سنسيتيف شويه بصراحه، يعني انا ببقى دلوقتي بقيت يعني ببقى واقف على قشر بيض كده وانا بدي كونسلنج لواحد اب اوريجينال يعني، تمام. فحاجات زي دي بتبقى مش بس في الاوسكي، لا، في الريل لايف كمان بتبقى حساسه كمان. اوكي، ذاتس ات. طيب يلا نبص على ال SOS. انا بحاول اكيب السيشن دي بالعربي. I'm trying to keep this session like we're trying here to give a balance between the Arabic and English. Okay, so شوية هتلاقوني بتكلم عربي شوية انجليزي. Okay, this is our SOS, what we call standardized OSCE scheme, the SOS. Okay, this is our recommended scheme. When you get in the OSCE stations, the first thing to do. Yes, questions? Okay, the first thing to do is to write down the steps if you can. When you get in the stations here and in the OSCE exams, you will be delivered like a block note, like a small note or something. First thing I did, I remember, first thing I did is I wrote down everything, all the steps, to not forget anything. Okay, we have three main parts here. ثلاث أجزاء أساسية. First one is the assessment, and here it's most counted in the patient care competency. الاسسمنت بتاعك ده المهم، ده من الاخر كده اللي فيه 3/4 حل الستيشن. اوكي، بعد كده بتدخل على الكونسلنج بارت. انت بتحل بقى خلاص، بعد ما بتجمع الانفورميشن بتاعتك، بعد ما بتعرف كل حاجه عن العيان، بتبتدي تحل المشكله بتاعته. اوكي، بعد كده بتعمل فولو اب. في الفولو اب بتلاقي النون فارم تكنيك، لو في نون فارم تكنيك عايز تقوله، امتى العيان لو ممكن يروح للدكتور بتاعه، لو في فاكسينيشن، واهم حاجه اللي احنا بنقول عليه الفولو اب بتاعك. اكلمك كمان يومين 3 4 او اي وقت انت شايفه. اوكي، ذاتس ات. طيب في الكونسلنج بقى، ودي اللي هنا this is our main objective for today's session, the counseling part. Okay, but let me first have a sneak peek on the assessment part here. Okay, for whom? First thing, first question you have to ask, for whom? البريسكريبشن دي لمين؟ اوكي، ليك ولا لاخوك ولا لابنك ولا كذا. Review patient profile if you have any. If you have any patient profile, second thing to do is to review the patient profile. Any medical conditions, prescription, are you taking any prescription or over the counter, herbals, vitamins, allergies? If yes, what type of allergies, what type of reaction you had? If pain, if you are in pain, how bad on pain scale, location, type, and etc. if you can give. Pregnancy, breastfeeding for women, تمام. Weight, in some cases, not in every case. Okay, you have in some specific cases, like if you have like a pinworm, malaria, plan B, or something like that, here the weight is very important. Profession, maybe in some relevant cases as well, if especially in allergic patients, or they're like whatever, any patient has atopic dermatitis or asthma or anything, profession could be considered here. Exercise, eating habits, alcohol, caffeine, check for red flags. This question is very important here. Okay, when you are done with your assessment, when you assess everything, you you pose your questions and everything is okay. Do not forget to ask this one. Okay, this one is the magic key. Do you have any other concern? Would you like to share any other information with me? Okay, قبل ما تدخل بالظبط كده على الكونسلنج والبيشنت هنا الريفرنس تشيك، قبل ما تروح الريفرنس تشيك لازم تسأل السؤال ده. ممكن يكون هو مخزن لك سؤال تاني بعد ما ترجع من الريفرنس. الحاجات دي احنا قلناها قبل كده كتير. اوكي، والسؤال ده مهم جدا جدا جدا. لو في العيان فيه ممكن بعض الستيشنز الناس بتدخل باتنين كونسيرن، بيرمي لك واحد وبيخليك ترجع من الريفرنس وبعد كده بيجي رازعك واحد تاني في الاخر كده، طبعا يكون فات الاوان خلاص. لو هو انت سألته السؤال ده وهو عنده اتنين كونسيرن فهيرمهم لك في الاول، خلاص انت داخل الريفرنس بتاعك وانت عارف انت هتعمل ايه، هتدور على ايه. اوكي، بس في السؤال ده مهم. اوكي، طيب حد عايز يزود اي اسئله؟ في اي اسئله عايزه تتشال او تتزود؟
بعد إذنك أنا ليا بس سؤال صغير. إحنا لما بنعرف لما بسأله لما بسأل المريض is this a prescription for you، بعد كده بقول له can I know your name أو can I tell you كذا، يعني إزاي أعرف الأيدنتي بتاعة المريض؟
مش فاهم أرميا بصراحة.
Sorry, what's your question, Armia, please? What's your question?
Okay, the question is when I ask the patient for whom in the first point, okay, is this prescription for you؟ فهو بيرد عليه ويقول لي yes. Okay. After that I tell him are your name is كذا ولا أنا أقول له what's your name or can I call you كذا.
This prescription is for Mr. Armia. Is that you? وضربنا عصفورين بحجر وخلصنا.
حلو،
مش هنقعد نتكلم 3-4 دقايق في الموضوع ده. فاهم قصدي؟
تمام.
بس خلاص كده.
Yeah.
Armia.
doing it.
The scheme here is very long, and in the exam sometimes you have to go through all that scheme to get the DTP. It's your skill and it's your way of practice to go through it within 2 minutes. That's from my experience. If you went through the exam, the whole scheme, and you covered like 90% of it in 2 minutes, you will pass the station. Some people you will see here, some people don't have time. I ran out of time. Why? Because you will notice that they repeated the question 2 times, 3 times, and they were a little bit reluctant about like this, so that they go back, and then they jump from one. So they're not organized. That's what I'm trying to say. They're not organized. They're not straight to the point. You know, so my advice to you: pick up a sentence, small, short, and clear, to get what you need. That's it. And it comes by practice, by the way. Okay.
تمام.
تمام.
اوكي، الحته الاولى دي فعلا لازم تخلصها في دقيقتين او 3. اوكي، وتاخد take 1 to 2 minutes to review your assessment, check reference, prepare for counseling. بعد كده بتاخد لك دقيقة أو 2 هنا، وتدخل بعد كده في إيه؟ أوكي، بتشوف الريفيو الأسسمنت بتاعك. يعني أنت بتاخد دقيقتين هنا، أوكي، دقيقتين هنا، وبتاخد لك دقيقة أو 2 في الريفرنس بتاعك. أنت داخل المفروض أنت عارف هتدور على إيه، وتدخل دقيقتين، يبقى كده عندك 4 دقايق. لو أنت خلاص، أنت المفروض بعد ما بتوصل المرحلة دي هنا كده، المفروض أنت عرفت المشكلة فين وأنت داخل تحل، أنت مش داخل لسه تستفسر. أوكي، فبتدخل بقى تدي الكونسلنج بتاعك. الفولو اب بتاعك ده ما بياخدش 30 ثانيه بالظبط، مش عارف ايه. ولو في اي حاجه تقولها بالظبط، والحاجه بس حاجه او حاجتين نون فارم، وانت تشوف الدكتور بتاعك لو حصل مشكله كذا، وانا هفولو اب معاك كذا بس، وباي باي. كونسلنج بقى بتقول ايه في الكونسلنج؟ If you have a new medication, you have to mention 4 items here. Okay, first thing is the indication. For what reason? Name of the product and its active ingredient, its intended indication. The doctor prescribed you today Ventolin. Okay, mainly we use this medication to treat asthma or like difficulty in breathing. Ingredients that contains an ingredient called salbutamol, for example. Okay, that's it. بالظبط، المفروض تقولها بسرعة، ما تاخدش منك 10 ثواني بس. Okay, so indication is the first thing. If it's a brand name, you have to mention the generic name, the active ingredient. Efficacy, usually it gives an effect within few minutes, like 4 or 5 minutes. You will feel better. If not, you can repeat the inhalation. You can take another puff, for example. Okay, duration of treatment. After how long can we expect positive outcome? Okay, safety and side effect. Generally speaking, this medication is well tolerated. There is no like major side effects, except in sometimes you may feel like dizzy, something like that. It may get you some headaches and etc. Okay, if that happened, don't worry about that. It's not a big issue. It will goes away after a few minutes. That's it. ده أنا بتكلم كل ده على الفنتولين. Okay, compliance. How many times I have to use it? Should I use it with or without food? Should I take it every day or only when needed? What if I miss the dose? For Ventolin, there is no problem. It's not a big deal to miss a dose. Okay, take till complete duration of treatment. Usually for antibiotics, you have to mention this part. You have to take this medication till the end. Otherwise, the infection may risk to come back. Okay, that's it. So indication number 1, efficacy. After what time, after how long should I expect a positive outcome? Safety and side effect management, if any side effect that we can manage or prevent, like with opioids, it's very recommended to take to increase your intake of fruits and vegetables to prevent the expected constipation with this type of medications. اوكي، لو عندك مورفين، عندك كودايين، something like that، ممكن تقول الكلمتين دول. دي طبعا داخله في البيشنت كير. طبعا السايد افكت مانجمنت is counted under the patient care. It's very important. Okay, compliance. How many times per day? 1 or 2 tablets. Okay, should I take it for about 7 days, 8 days, for 1 year, etc. That's it. Okay, واضحة؟ Any questions? أي أسئلة؟ يبقى indication, efficacy, safety, compliance. على فكرة ده دورك كصيدلي. ده دورك الصيدلي فعلا. هو أنت واقف ليه في الصيدلية؟ أنت واقف عشان ده. ال ETA اللي زي ما بنسميها كده، ال efficacy, effectiveness, tolerability, adhesion. اوكي. ETA efficacy tolerability adhesion او adherence. ده هو دورك بالظبط كده بتاع الصيدله بالظبط، هو الثلاثه دول، وده اللي انت بتقوله في الكونسل. اوكي. فولو اب خلاص مش محتاجه نتكلم فيها كتير. تمام. Are we good to go؟ أي أسئلة؟
Okay. We have some stations here as a practice, and then we're gonna discuss it together. Okay.
Yeah, sure.
But we need participation for sure.
اوكي.
عندي بس سؤال قبل ما نبدأ، مش ممكن في البارت 1 ان احنا نضيف 1 or 2 open ended question، ان احنا نقول له يعني قولي السيمبتومز اللي عندك، عايز تضيف حاجة تانية، ايه تاني؟
طبعا طبعا
مهم.
طبعا انت بتسألي.
اوكي، انا
تمام.
بس
هو
مش
كل ده
ما
هو كل دول
لقيتهاش
على فكرة
مكتوبة في
أغلبهم
السكيم.
Yeah,
أغلبهم
على
open
فكرة
question.
السكيم ديت احنا عاملينها يعني على قدر ما استطعنا بصراحة. تمام.
الله
However,
يعين.
it's every scheme should be customized. احنا حاولنا نجمع كل الحاجات اللي موجودة اللي شفناها يعني. تمام. However, in every station السكيم دي should be customized to the situation.
مظبوط مظبوط.
تمام.
طبعا.
اوكي.
Yes. it's your call بقى. it's your skill and to get the DTP. ممكن تسألي سؤالين ثلاثة وتجيت الدي تي بي، في واحد تاني يقعد يسأل 10 أسئلة. تمام.
تمام. يعني هو if you
اي
don't
حاجه،
mind
اي
ممكن
اضافه
نحطها
definitely
مثلا
اي حاجه متاحه
رقم
انك انت
3.
تزودي او تنقصي it's your call. It's your call
اوكي
as a pharmacist والسيتويشن. وطبعا
اوكي.
yeah. يلا نهى بقى،
طيب
نهى يلا ابدأي معانا اول ستيشن.
اوبس.
شباب انتوا كلكم على ال
انا اللي جبت ده نفسي.
كلكم يا جايز على يا جايز صحيح، انتوا كلكم يا شباب على على الاوسكي، على الواتساب جروب.
الواتساب جروب right, everybody is on the WhatsApp group because we're
I
gonna send
shared
the
it.
station
Yeah,
and
I
the
shared here
reference
the
over
link.
there.
وبس في واحدة مش قادرة تدخل، تقريبا الجروب كومبليتد، فمش عارفة تدخل. هل يا ترى في طريقة تانية؟
في جروب
طلعوا
تاني
شمس بقى، طلعوا شمس وخلاص ودخلوا واحدة مكان.
لا دي شمس نورتنا.
انا هطلع شمس دلوقتي.
طلع شمس دلوقتي بصراحة.
كلنا نمشي إلا شمس.
عاملة زحمة شمس دايما.
تفحص كلها 3 ساعات وتطلع.
Okay, here there is I shared another link for the other group. Yeah, it's here.
تمام.
اوكي لحظة
You
بس
have
ابعتها
to
لها.
join the OSCE WhatsApp group because I'm gonna share the references there. Okay. تمام.
انا للاسف مش عارفة ابعتها لها، فلو ليلى سمعاني بليز
بعتها
يا
لك
ليلى ابعتيها.
انا
بعد
بعتها لك
اذنك.
تحت. انا شايف في 2 دخلوا اهو.
طيب
تمام. Very good. يلا بينا. So we're gonna start guys. Station number 1.
لحظة واحدة. تمام اوكي.
Okay, very good.
انا اللي هبدأ ولا ايه؟
So for whoever didn't went through that exam before, usually there is 30 minutes. You're gonna 30 seconds. You're gonna stand in front of the door, and there is a door note. This door note will tell you what you're gonna do inside. Okay, it is like, for example, a doctor station, a counseling station. Today is gonna be counseling everything. Everything's gonna be counseling. But in general, in the exam, this door note you have to read it properly because it will tell you what you're gonna do. So, for example, if there is a counseling station, so that we assume we're going to dispense and counsel. No DTP, no stopping the prescription. Got it?
Okay, got it.
Oh, okay.
Okay, my friends.
طيب هو في ريفرنس على
بعتهولك
اتبعت على الجروب دلوقتي؟ تمام
بعتهولك. في ناس مشكلة، في ناس بتدخل بعد ما انا عملت ثانية واحدة معلش.
The most important journal. Shams is panicking from the non-interactive.
اوكي يا شباب يلا بينا. بعت لكم الريفرنس على الجروب. اوكي. You should have it now. ايش هو ده امين؟ ده انا اول واحد يا جزولي صح؟
وريني كده، انا مش فاكر بصراحه.
يا
Yes, that's yours.
طيب ضحى يلا بينا.
يلا بينا. اوكي.
Get the reference.
Get the reference. Yes.
Here you go. This is the reference, guys. Information for healthcare professionals switching between insulins and disaster مش عارف ايه. Okay, here we go.
Okay, who's gonna take care of the
ممكن
timing because it's 7
يلا.
minutes.
انت جزولي؟
Okay.
ماشي، هتقول لنا قبلها بدقيقتين كده ان الوقت خلص.
Support. Okay, so when you wanna start
ثانية كده. لو انت
Okay.
بتبصي في البتاع ولا ايه؟
نعم.
انت بتبصي في الريفرنس ولا ايه؟
لا اطلاقا.
طيب معاك 30 ثانية. يلا جو ahead. You have
كلام بتخوني من اولها كده.
30 seconds وبعد كده رد ابعت يا جزولي، قصدي اشتغل.
ماشي.
انا بس السكرين قدامي صغيره قوي، مش عارفه اكبرها ازاي بصراحه. ايوه اشكرك اشكرك اشكرك.
Okay, you can start يا محمد.
30 دقيقة خلاص.
30 ثانية خلاص.
Yes. Can I speak to the pharmacist?
Hi, I'm Noha, the pharmacist in duty today. How may I help you?
Yes, Noha, how are you? Actually, yes, I'm in a big trouble, actually. I lost my insulin pump. You know, I have to take my insulin today. I don't know what to do. And I don't have the time to go to the emergency there. I will have to wait like about 5 or 6 hours, and I have to get my insulin now.
Sure, I will address all your concern. Please have a seat in our private counseling area, and everything will discussed will keep confidential between me and you, and I will do my best to help you. I'm sorry for your insulin pump, and sure, I will help you. Just let me gather more information about your medical history and lifestyle, if you don't mind. First, how may I address you?
Angela Merkel.
Angela. How old are you, Angela?
24.
24. Nice to meet you, Angela. So your concern is about your insulin pump. You lost it today, right?
Yeah.
So did you take your dose for today?
Yes, the last dose, I think it was since 4 hours or 5 hours.
Okay. And what is the dose usually? What is the regimen for your insulin?
It's like insulin pump. I don't know what the dose actually, what the accurate dose is, but you can say I take about around 30 units per day.
Okay, so you take it. You take it once. You take it once.
You know what I mean? You know.
Yeah.
What is the
Yeah. Okay. Yeah. Insulin pump. I'm sorry for that. Okay, so in order to help you and give you better recommendation, I have to gather more information about your health condition and lifestyle. Do you mind to share this information with me?
Yes, I told you. Yeah.
Okay, so do you have any medical condition other than diabetes?
No, diabetes only.
Okay. What is your last HbA1c?
What is it? What is that?
Your last blood sugar reading.
It should be fine. It should be fine.
Should be fine. Okay. Any allergy, Angela?
No, I'm not allergic to anything.
Good. Do you take any other medication other than the insulin pump?
No, only that.
Do you take any over-the-counter drug like Tylenol or Advil?
Yeah, sometimes.
Okay. Why you take these OTC products?
For muscle pain, headaches, something like that.
Okay. And you take it regularly?
When needed only.
When needed. Okay. What about your vitamin? If you take vitamin or natural product or herbal?
Yeah, I'm taking vitamin D.
Vitamin D. Okay. Does the doctor prescribe it for you, or you take it by yourself?
I'm taking it by myself.
Why?
Because we're here in Canada and it's not sunny all the time. So
Okay.
I read an article about that, and is there any problem?
No, there is no any problem, but I have to know, did you measure your vitamin D in your body before you take it? Because sometimes we don't need this vitamin D. That's why.
No, I didn't.
Okay. So what about your caffeine, Angela?
No, I drink coffee.
How much cup per day?
About 5.
Okay. And what about, do you consume alcohol?
Yes.
How much?
About 2 per day.
2. Okay. Are you smoker?
Yes.
How much cigarette per day do you take?
20 per day.
20. Are you willing to quit, Angela?
No.
By the way, our pharmacy offer a program for smoking cessation. If you would like, I can make appointment for you. It will help you a lot in your general health.
Yeah, no problem.
Okay.
Yeah,
Okay.
would you give me my insulin, please?
Yes, I will do, but I have to complete my information. I will do it so fast. What about your exercise, Angela?
What exercise?
Do you exercise every day? Like walking, jogging, bicycle?
Do I have to?
Yeah, it's very important for our life generally, and for diabetes especially.
No, I do not exercise.
Okay. Could you tell me about your diet? How's your diet?
Junk food.
Junk food?
2 minutes left.
Okay.
2 minutes left.
It's better to make a healthy lifestyle for diet, as it will help you a lot to control your blood pressure, your blood glucose or blood sugar level, and it will help you better in your health generally. Do you take any recreational drug, Angela?
Yes, weed.
Weed? Okay.
Yeah.
Is it for recreational only or for medical purpose?
That's for fun.
Okay. So I will check my reference and come back to you shortly. Before I leave, do you have any other concern so far?
Yes, I need my insulin.
Yeah. Okay. I will address that. Do you have any other concern?
Thank you. No, that's it.
You're welcome. Okay. Thank you, Angela, for your patient. According to my reference, I do recommend for you to see your doctor, because he has to switch you to another insulin product, or he has to give you another medication for your blood sugar. So I can't do it in the pharmacy right now. So I do recommend for you.
You cannot do it?
Yeah.
Why are you asking me all these questions?
Because I have to gather more information about your health to know if you have any other medical condition. So it's better for you to might be it take time, but I have to do that. So if you don't mind, you can go to the walk-in clinic. You can go to when is your next appointment with your doctor?
You can guess, my friend. Last dose was 5 hours ago.
I mean your appointment with a doctor.
Okay, so I will see my doctor in 1 week.
1 week. So I do recommend for you to go to the emergency ER, or to go to walk-in clinic. Which one is preferable for you?
Neither.
Time is up.
Okay. Give
Time
me.
is up. Noha.
Nah.
In 7 minutes ago, okay, I told you we are practicing counseling stations. That means you're gonna dispense something. There's no DTP. You're gonna dispense something, and you're gonna counsel on it. You didn't dispense anything, and you just let her go to whatever. In the beginning, he told you, I will never ever go to emergency.
Do not assess, please. Okay, madam.
I'm just
لا لا
telling you that
استنى،
we are
احنا هنقول assessment لانه في الاخر هقول لك الاسسمنت كل حاجه. اوكي
اوكي
تمام. طيب
اوكي
يلا عايزين حد تاني. Another candidate, one of the non-Arabic speakers that we have here. الجماعة اللي
Can I try?
Yes, let's go, my friend. Who are you? I cannot see your
Nora.
name.
Nora.
Nora. Where are you from, Nora? Iran?
Nigeria.
Ah, Nigeria. Right. Do you know what does it mean? Your name, Nora, means what?
Can't remember.
You cannot? You know the origin of your name?
Yes, it's English.
No, my friend, it's not
I
English.
doubt it's an
Nora
Arabic
is an
name.
Arabic. It's an Arabic name, my friend.
I'm not aware it's Arabic.
Yeah. Okay, so Nora means the light. In Arabic, it means the
Okay.
light, okay?
Right. Okay.
Yeah. Okay.
Good meaning.
Let's go, my friend. Okay, so are you ready? We do not gonna spend 30 seconds to check the references and etc. Okay, we're gonna step directly into the station. يلا عم جازولي.
Okay.
Okay, 30 seconds. Yeah.
Yeah, let's
Yeah,
go.
yes.
Hi, can I speak to the pharmacist?
Oh, sure. I'm Nora. I'll be glad to help you. Please have a seat in our private counseling area, and everything we discuss will be kept confidential. Okay.
Thank you.
Okay, so how may I address you?
Angela.
Okay, okay, Angela, what can I do for you today?
I'm in a big trouble, actually. I lost my insulin pump and I need my insulin. I have to take the insulin now.
Oh, sorry to hear about that. I'll surely do my best to help you.
Good.
Angela, could you confirm your age for me?
I'm 24.
Okay, you're 24 years old. And aside from this insulin which you're using for your diabetes, is it type 1 or type 2? Do you know?
Type 1.
Type 1, okay. Aside from this, do you have any other medical condition?
No.
No. Okay. Do you have any allergies?
No.
No. Okay. Do you take any over-the-counter medication, any herbal vitamins or minerals?
Yeah, I'm taking Tylenol.
Oh, okay. You use that for pain?
Yes.
Okay, sure. Okay. Aside from this, I'd like to ask you a few questions about your lifestyle. Is that okay with you?
Yes, go.
Okay. Do you take caffeinated beverages?
Yes.
Okay. How many cups?
5 per day.
Okay.
2
How about alcohol?
2 alcohol, 20 cigarettes per day.
Okay.
That's it.
Okay. Okay. In respect to the insulin pump that you lost, I can see that you use the insulin Lispro U 100 units. Okay. Could you please give me a few minutes to just check in my reference and then I'll get back to you?
Yes, go ahead.
Okay. Please, can you scroll up to see the reference? I can't see the reference.
It's in the WhatsApp group.
Oh, I couldn't join the group. Oh my God.
That's it. Okay, I can share it here with you. Can you see it in the screen?
Yes.
It's not a practical way, actually. Yeah. Just let me know when you want to stop.
No, you can stop in the upper part.
Can you stop?
No, upper part, the part that has the Lispro. There's no Lispro here. Angela, when was your last dose? You lost your pump when? When did you lose your pump?
5 hours ago.
5 hours ago. Okay. And have you noticed anything strange, maybe a fruity smell or anything?
No.
Okay. When last did you check your blood sugar?
Today I didn't.
Okay, that's okay. Okay, so I'm going to give you do you know what dose you are taking with your pump?
I don't know accurately how much is that, but I think it's around 30 units per day.
Okay, 30 units per day.
Yeah.
Okay, so I'm going to dispense another one for you. I can see that you have refills here. So I'll give you another I'll dispense another one for you, and I'll follow up with you to see how you're doing. Okay, so we're using, could you scroll up, please? This doesn't have the drug.
What?
List Pro up. Could you miss the reference up? This Pro is not here.
This one?
No, the reference, but where I can see Umalog. No, down. No, up. Up, I'm sorry. Yes, Umalog. Okay. Okay, and when is your next you're using the comb? When is your next meal?
In 1 hour.
In 1 hour. Okay, so I'm going to be giving you another Umalog, which is insulin Lispro, 100 units, just like the same one that you had. You have to use this medication before your meals.
Okay.
Before meals.
How many units I should take?
Hi guys.
How many units?
You should take, okay, you said you were taking 30 units per day, right?
Yeah, in the pump.
In the pump. Okay, so we're going to start from a new start again from a new titration. So you can start with 5 units.
Okay. Good.
I can see the starting dose here.
Good.
Can't find it. Yeah, so you can start with 5 units before 15 minutes 15 minutes before the start of your meal, and then I'd encourage you. Do you have a blood pressure blood glucose monitoring machine at home?
Yes.
Okay, so I'd encourage you to please check your blood sugar, just to have an idea of what your blood sugar is. Then take the insulin 5 units to start, and then depending on how your blood sugar is, you can either increase or decrease the dose. I forgot to ask you, are you could you be possibly pregnant or breastfeeding?
What is it?
Could you be possibly pregnant or breastfeeding?
No, I'm not.
No, okay. Okay, so
okay.
there's a critical side effect of this medication is time up.
Time's up.
Yeah, time's up. Okay. Guys, what's the problem here? Do you got anyone arrived to the answer? Get the answer? حد وصل للحل يا شباب؟
هو المفروض إن هي هتاخد 20% أقل من 30 دي.
30 إيه؟ تاخد 20% أقل من 30. أوكي.
أعتقد إن إحنا المفروض لازم نسألها على وزنها ونضرب بعد كده ب 0.3 و divided by 6.
Yes.
وبعد كده المفروض نفاكس الدكتور عشان يكتب لها كمان البيزل.
أيوه، نفاكس الدكتور ليه؟
عشان يكتب البيزل أو لو هي هترجع تاني للبامب.
طيب هي مشكلتها إيه؟ الست دي مشكلتها إيه؟ إنها تايب 1 دايابيتس.
دي كي إيه؟
independent.
ينفع تعيش من غير انسولين دي ولا ما ينفعش؟
لا
مستحيل.
طيب هي كانت بتاخد بامب. البامب هل احنا بناخد في البامب بناخد بيزل ولا بناخد بولس ولا
بولس الرابط؟
بولس.
ليه ما بناخدش بيزل في البامب؟
لأن هي بتشتغل حسب الأكل اللي داخل لك.
الله ينور عليكي، لان
مهم.
هي شغاله على طول تك تك تك
مهم.
تك،
بالظبط.
شغاله
مهم.
24 ساعه، فتحتاج بيزل. البامب
مهم.
وقفت، يبقى لازم نعمل ايه؟ لازم تاخد حاجه
دخله بيزل.
تشتغل مع 24.
دخله بولس.
اوكي، فلازم
مهم.
لازم تاخد بيزل،
مهم.
لازم تاخد بيزل. لو بصيتوا في الاخر كده هتلاقوا هنا في الريفرنس مكتوب insulin pump. Individuals with type 1 have priority for receiving insulin. Even a few hours of interrupted insulin therapy can result in life-threatening DKA.
مهم.
When was her last dose of insulin?
5
5 hours ago.
مهم.
Okay.
مهم.
So referring here to the emergency, referring here to the doctor is not the best idea here.
مهم.
Okay.
Okay.
If patient doesn't have a plan for pump failure, consult with the healthcare professional. Okay, makes sense. When the insulin pump cannot be used, basal insulin is the primary need with rapid or short-acting insulin, a desirable addition. How to calculate the basal? That's it. 0.3 per kilogram once daily, number one. Second, how to give the rapid. Okay, that's it. As you said, 0.3 per kilogram divided by 6 at each meal. تمام?
مهم.
Simply speaking. Can we give both? Can we give the basal and bolus? Yes, you can. تمام؟
Okay.
معلش يا دكتور، يعني أنا هدي البيزل من غير prescription؟
هو
طبعا
اصلا الانسولين without a prescription.
طبعا.
It's behind the counter.
مهم. مهم.
Someone can come to the pharmacy. Please give me whatever insulin you have. You give him, let him go. It's not a prescription medication.
That's it. Simply speaking.
تمام؟
وصل؟ بس كده
أم،
بمنتهى البساطة خالص.
ايوه. وبعد
Okay.
بعد كده يا دكتور هقول لها ايه بقى؟ تروح للدكتور ولا تروح الامرجنسي ولا تروح ايه؟
طبعا لازم تاخد الانسولين وهتكيب ان اي وتسأليها سؤال ظريف جدا. انت البومب بتاعتك فين؟ باظت ولا نسيتيها؟ تقول لك والله انا نسيتها عند واحدة صاحبتي.
مهم.
طب هترجعي تاخديها؟ هاخدها على طول النهارده بالليل او بكره الصبح. That's it. خلاص كده. لا
مهم.
تروحي للدكتور يا صفية ولا تيجي من الدكتور يا صفية.
she's covered. اوكي.
تمام؟
طيب معلش، لما تيجي تاخدها تاني المفروض توقف البيزل قبلها بقد إيه؟
لما تيجي تاخد ايه؟
لو هترجع على البامب تاني، عارفة مكانها وعارفة إنها هترجع بالليل مثلا أو بكرة تاخد
خلاص مش
البامب.
محتاجة بقى توقف، هي البيزل هتوقفه، هي تاخده وانس وخلاص. ذاتس ات. هي البتاع امتى هي البامب دي لازمتها ايه؟ ما البامب دي بتقيس، بتشوف لك الانسولين، انت عايز انسولين ولا مش عايز. خلاص انت عندك انسولين مكافي والسكر بتاعك كنترولد within limit، نو نيد. هي البامب مش هتحقن، مش هتديك انسولين. فهمتي؟
مهم.
وصلت؟
شكرا.
بس خلاص. Okay, is it clear
Okay.
Excuse me,
for the non-Arabic speakers? Is it clear, my friends?
can I ask a question?
Yeah, go ahead.
Shouldn't we like have a decrease in the dosage, because now we're switching like 20% reduction in the daily dosage of the insulin
Why you have to do that?
It's
to
in the.
like
It's
avoid
written.
hypoglycemia.
It's written on the. The switch is written on in the reference. We just copy paste it. That's it.
Here
Okay.
it is. It's here, my friend. When insulin pump cannot be used. Okay, basal insulin is the primary need with the rapid and short-acting insulin. It's here. The calculation is here. Okay, my friends.
دكتور ايه النون فارما اللي ممكن نقولها هنا للست دي؟
نون فارما. طب انت قول لي بقى كده ايه النون فارما بقى؟
بتاعني انت يا ام ارميا.
I will speak in English for the non-Arabic speakers. So for the non-pharma of the patient self-care, first of all, I have to tell her that to measure her blood sugar 6 times per day before and after meals. As it is.
There is a very. I'm sorry to disrupt you, but there is a very important question. I believe Noura asked this question. Do you have a fruity smell right now in your mouth? So that's a very important question, and then we can start from there. So you have to. She made sure that the patient in front of her is clean, like it's not in an emergency situation. That's number one. I believe Noha didn't ask this question, right? Then after that, to avoid this, you can say whatever you want, like frequent measuring, give her the targets. You have to ask about the targets the doctor tell her about, stuff like this.
Yes.
And he told you, Muhammad told you a very nice noun form. Yes, I'm a smoker. I'm alcohol and a drinker, like I'm a coffee drinker and a junk food, eating all this.
اوكي.
Right.
الكونسلنج يا شباب، الكونسلنج خلوه في الاخر. نهى كانت بتاخد حاجه وبتدخل في النص. بص يا نهى، انت خدت وقت طويل جدا 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 في الاسسمنت جدا. جدولي قال 2 minutes remaining وانت لسه بتحكي في الاسسمنت.
وفيتامين دي. Why you're concerned about the vitamin D?
فاهم ايه فيتامين دي؟ هيعمل ايه؟
Who cares about vitamin D?
مش ممكن يكون عنده الفيتامين دي ستيبل، مش محتاج
فيتامين دي. ما
Have you
تبلع
heard about
فيتامين
any
دي.
vitamin D toxicity? so who cares about vitamin D in this situation?
مش عارف. بتسالي ليه على برضه؟ سالتي برضه كام سؤال كده، الاكسرسايز ومش عارف ايه وبتاع.
Yeah, who cares? It wasn't relevant and it took so much time, Noha, from your yeah, so much time.
انا ما خدتش بالي اصلا ان هي كونسلنج يبقى ادخل لها على الموضوع على طول، ان ما فيش اي دراج بروبلم ولا اي حاجه. ما خدتش بالي من النقطه دي في البدايه بصراحه.
I told you before you get in. I told you counseling means you have to dispense the medication. Consider no.
ما خدتش بالي خالص، معلش.
That's it. Yes.
تمام. Counsel here. Those patients is approaching you for a concern regarding her medical condition. Counsel here as usual. لازم تعملي كونسلنج. خلاص انت كان كونسلنج هتديها الانسولين لانتوس، هتقولي لها كذا 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 كذا.
اوكي.
تديها الكونسلنج بتاعك ظريف جدا وخلاص. بس خلاص الموضوع سهل جدا.
يعني الست دي انا مش عايزه منها اي حاجه تانية غير ان انا اعمل لها بس كونسلنج على الدواء.
انت ما بصيتيش في الريفرنس اصلا.
ما خلاص ابص ايه بعد دقيقتين وانا لسه اصلا في الجاذرنج انفورميشن؟ ابص ايه؟
بالظبط. وقعدتي تحكي معاها وفي الاخر تقولي
ما انا مش واخده بالي بقى ان الكيس من البدايه اصلا كونسلنج على الميديكيشن بس.
طيب
I assume Noha considered okay.
انا تخيلتها كيس عاديه خالص، بيك اب اي حاجه.
Send her to a doctor, he will do it. No, this is not the case. Yeah, so just we don't know how to deal with the situation. Okay, send her to a doctor. It's not the case.
Okay.
Yeah, it's not the right solution in the exam too. By the way, it's your role to solve the problem, not to send her to a doctor.
Okay. We have a question here from Noha. أنت يا نهى اللي سأل السؤال ده؟
لا مش أنا.
Just a question. Another Noha maybe. If we give the insulin without RX, you must pay the full price of insulin or submit the receipt to the RAMQ or the insurance.
Okay, here because that's a federal thing. Okay, we don't care about the money. Okay, don't worry about the money. On the exam, don't worry about the money. The money is a provincial thing. For example, if you are a diabetic educator in Ontario, you can initiate a prescription like this. If somewhere else, you cannot. In BC, for example, don't care about the money. Okay?
طيب هنا في كيبيك برضه على فكرة. في كيبيك انت بالصيدلي بيكتب الدواء، ممكن بيعمل prescription.
Yes, exactly. It's a provincial thing. Yes, that's true. Our exam is a federal, so we don't talk about money. Who cares about the money?
Exactly.
Okay, that's it. Do you measure her blood glucose? You can ask her about the last things. It's fine. You can ask her about saving. You can tell her, okay, let's do it as a part of patient care. Let's see what's going on. Okay.
Yeah, let's go take shower. Yeah, I'm waiting you.
يلا بينا.
Because I have lecture now. Yeah.
What about the fire?
It's okay. I will come back.
Doctor, are we allowed to measure the blood glucose level in the pharmacy?
Yes, we are.
In the pharmacy, we can help with the patient in Ontario. We can help with the patient.
I mean for the exam.
Yes, you can. في الإكزام.
Sorry?
الإكزام لو أنت في الإكزام setup يعني.
Yes. Can I offer this? I will give you insulin respo, and before giving this, I will take your blood glucose reading or not? I'm not
أعتقدش
allowed.
إن دي بتبقى practical يعني بصراحة. ما
Okay.
أعتقدش.
Ask about what is the last reading, and that's more than enough.
Okay, perfect. Thank you.
Session 2
طب
يا
في
شباب.
حالة إن هو رد وقال لك إنه last reading it was fine، مش لازم بقول لها التارجت بتاع الدكتور كان حاطك على إيه ولا الكلام ده، صح؟
Oh, that's another question. That's another. It was fine. So that means. So do you remember the targets? Yes, between
ماشي بقى.
يلا let's go.
whatever 8, for example. Okay, there was that. أنا وأنت كده. We
يلا
already
let's
said
go.
that 8 is fine for her, and she comes to you
I will come back.
about 15.
I will
So
come back.
make sure that it reaches. You have to check and manipulate, increase 2 units until it reaches your target. That's it. الفاين التارجتس بتاعت الناس بتبقى مختلفة. whoever is asking يعني ماشي.
اوكي.
Yes.
ومين اللي بيتكلم؟ ايفون؟
Yeah. ويعني مبهدله الواد معاه. Yes.
Okay, guys, whoever is not yet in the WhatsApp group, please join now because we're gonna share the reference.
Okay, session number 2. Session number 2. Yeah, let's go.
Yeah. Okay.
Check ال بتاع محمد الوقت please.
Session 2. Okay. طيب استنى اشير بتاع ده على الواتساب جروب.
Okay, who's participating now?
I don't know.
Amy. أسامة.
I can do it.
يلا أسامة.
يلا بينا. تمام، الريفرنس جاهز؟
كله جاهز يا باشا.
انزل بقى محمد كده عشان مش شايف ولا حاجة.
طيب.
Can you scroll down? Yeah.
Station. معاك 30 ثانية. طيب ثانية واحدة أحسب له 30 ثانية.
ريفرنس 39 صفحة. تمام.
30 صفحة. لا بص ما تشغلش بالك بكل ده، يعني دور على الحاجات اللي أنت عايزها وخلاص.
يعني يلا let's go.
يلا معاك 30 ثانية يا باشا.
Hi, may I speak to the pharmacist, please?
يا ابني استنى معايا 30 ثانية.
Okay.
يا عود.
ده الحماس وحلاوة البدايات.
Noha, where are you located, if you don't mind me asking?
Vancouver. No, it's okay.
Great. Do you have someone to practice with in Vancouver?
Yes, I have.
Amazing. Put for yourself like minimum 3 or 5 exams per day, and you will pass.
Okay.
Believe me.
Exams or cases?
Exams.
Okay, guys, we have to start. Go ahead. 1, 2, 3.
Okay.
Yeah.
Okay.
Hi, my name is Osama.
Okay. Hi, Osama. How are you doing, my friend? I need my repeats on a medication for my asthma, Oralair.
Of course, I can help you with that, but to better assist you, I need to ask you more questions. So would you like to have a seat in our private counseling area? And everything we're going to discuss will be confidential. Is that okay?
Definitely, yes.
Okay, first of all, may I have your name, please?
Vladimir Putin.
Okay, I can see your profile here. You're 50 years old, right?
I am 50, yes.
Yeah, okay. And you need a refill for your post medications?
Oralair.
Oralair only.
Yeah, that tablet. I believe I got it from you guys before.
Okay. How long have you been taking Oralair?
I took it last year, and now it's the season. Yeah.
Okay. And was it working good for you? Any side effects from it?
No, it was good.
It was good. Okay. Also, I see in your profile that you take Nasonex as well.
Yeah, Nasonex. I got it actually.
Yeah, what are you taking that for?
To open my airways.
Okay. And how long have you been taking it?
Quite a while.
Okay, and no side effects from it.
Side effects? No side effects, no.
Okay, I see also that you used EpiPen before.
Buddy, I'm not having much time. I'm so sorry. Can you please give me my medication?
Of course, but for your safety and best counseling, I need to ask you more questions to give you the right counseling for your medication. So I will try to do it fast for you, and this is for your benefit and safety. Okay. So I see here that you took EpiPen like 3 years ago, right?
I picked it up. I didn't use it yet.
You didn't use it.
I picked it up.
And it is not expired yet, right?
No.
Okay, that's good. That's good. Do you have any medical conditions other than the allergy?
No.
Do you take any prescription medication other than the listed ones that I mentioned?
No.
Okay. Do you have any allergies?
Any allergies? Yes, that's why I'm taking my medication. Yes.
Yeah. Other than like a seasonal allergy, like allergy from medications.
No.
Okay. Also, some lifestyle may affect you taking this medication. So I will ask you more questions regarding your lifestyle.
No, I don't need more questions. I need my medication. I don't need more questions. Please.
Of course, I can. I will address that in a moment. Okay. But as I told you, these questions are for your safety and your.
I do not accept it. I need my medication. I know you told me for my safety, yes, but I don't need it. I need my medication.
Okay, I will document that in your profile that you refused like this question this time. Okay, and we can do it also later.
I got this question 5 days ago when I was picking up the Nasonex. Same questions exactly.
It's always a good idea, Vladimir, that to ask these questions, to update your profile and to be updated with your case to better counsel you and detect any red flags or alarms that you may experience. Okay.
Okay.
So give me a moment to check and collect my thoughts, and I will return back to you. Do you have any more questions?
No.
Okay.
How many minutes?
Two minutes remaining. 2 minutes بالظبط.
Okay, Vladimir, this is your medication, Oral 300. as the doctor prescribed it for you before, and you told me you used it before. This is indicated for the treatment of symptoms of moderate to severe seasonal grass pollen allergy, rhinitis. This is the allergy that you have, right?
Yes, exactly. Okay, so I'm
Okay.
going to take, so okay, so you're going to give me 300 milligrams to be taken once daily?
Yeah.
Okay.
Okay, so this, as you know, it has a benefit in allergy, but also as she.
Okay, so should I take it with the one that the doctor gave me 2 days ago?
What?
He gave me the same.
Nasonex?
No,
Okay,
he gave me the same medication. Should I take it all together or just through whatever I have?
Did the doctor know that you was taking Olarir last year?
Yeah, exactly. He's the same doctor.
Okay, time is over. Time is up. ماشي يا شباب خلاص.
Okay, someone else? I know, I'm so sorry. I'm so sorry to be a rude patient, but it's meant to be in that way in the station, because I know that you're gonna ask a lot of like questions that is not relevant. So I was trying to push you, but I'm so sorry in the way I did it. Okay, anyone else?
طيب.
I can.
حد عايز ياخدها؟
إيمي؟
Yeah.
يلا إيمي بقى، يلا ربنا يجعل في وشك القبول.
يا رب.
يلا بينا. محمد start the.
Yes.
Yeah.
يلا بينا 1 2 3 جوه.
Okay. Hi, may I speak to the pharmacist, please?
Yeah, my name is Iman. I'm the pharmacist in today. How can I help you?
Hi, I'm here to pick up my asthma medication or allergy medication. Sorry, allergy.
Okay, so
I believe.
Okay, so this prescription is for Vladimir. Is it you?
Yeah, that's me.
Okay. It seemed that last time you take this oral, it was last year. Was it correct?
Exactly. It's an annual thing. Yeah, to control my my allergy, and it's due as per my doctor. So I'm here to pick it up.
Okay, and according to your profile here, I see that you took Nasonex like 5 days ago.
Yeah, exactly.
Why did you start this medication? Is it new for you?
No, it's not for you. New. Which medication you're talking about?
The Nasonex?
No, it's not new.
Okay, so you've been on that for a long time?
I took it, yeah, quite a while ago. Yeah.
Okay, and is it for your asthma?
To open the airways, exactly.
Oh, okay, and is your case controlled?
When I take my medication, it's controlled.
Oh, okay, okay. And what about the EpiPen? You didn't fill it since 3 years ago?
The last time I picked it 3 years ago, but I still have it. I didn't use it yet.
Okay, but is it still like, is it expired? Did you check
No,
the
it's not
expiry date?
I check frequently, yes.
Okay, and do you know how to use it?
Definitely.
Oh, okay. So can I just ask you a few questions to better give you my...
Please, because I am really in a rush and I need my medication.
Okay, okay. It is just a few questions, quick one, if you don't mind. Okay. So do you have any like new allergy or anything new?
Good.
Okay. Did you start any new medication in the last few months?
No change.
Okay. Do you make any exercise?
No, no change in my lifestyle. Same thing as like last year.
Okay, okay. So okay, as you know, this medication, the Orolair, it must be taken like 4 months before the season of the pollen.
Yeah, it is the right time, I believe, as per my doctor. He just contacted me and I was at his office 2 days ago. I had to pick it up.
That's great. And like, do you know how to take it? Like last time, did you take it in the same way? So the first day you should take 1 tablet from the 100. Then in the second day, you have to take 2 tablets from the 100. And in the third day, you have...
Actually, my doctor gave me 3 tablets of 100. So I took 1 at his office.
Yeah,
And then,
that's great.
yeah, I don't know what to do with the other 2 tablets.
Okay, so the
So
next
then
day,
take it from you.
yeah, so the next 2 tablets, you have to take it in the second day. So if you take it, the 1 tablet you say you take it yesterday with the doctor office?
Yeah, I took 1, and I don't know what to do with the other 2 tablets. He
So
gave
the
me 2
other,
tablets of 100 milligrams.
okay, so the other 2 tablets, it should be taken today. Try to take it in the same day, like if you take it yesterday in the evening, take it today, the 2 tablets today. And starting from tomorrow, we will start the 1 tablet, which is 300.
Okay, so whatever I take from you, I'm going to start it today.
No, the 2 tablet you have already from the doctor office, you have to take it today. The tablet I will gonna give you, you will start it from tomorrow.
Okay,
Is it clear?
it's clear.
Okay, okay. And so do you have any other concern for today?
No.
Okay, I just wanna like remind you with your vaccination. Did you update your vaccines?
Yes, it's up to date.
Okay, and flu vaccine, pneumonia vaccine, and everything?
Mm-hmm.
Okay. Just I would like to remind you, if you are a smoker, try to avoid smoking. And if you know that you are going outside, try to take care of the areas or places that has a lot of pollens. Try to keep your mask if you can.
Yeah, but how come? Like, because you know this time of the year, sometimes it's unavoidable, you know. So
Yeah, I know it's hard, but we can try our best just to try to keep your mask, try to keep your windows closed as you can.
Okay.
Try to exercise inside if you can for these few months only. I know it's hard for you sometime, but try your best, please.
Okay.
Okay, you can contact me anytime if you feel anything, and for sure, if any like severe symptoms, severe allergic symptoms appear, you have to use your EpiPen, and if it's not controlled, you
I
can.
know when to use it. Yeah, I know when to use it. It's okay.
Oh, okay, okay. Do you mind? Okay, do you mind if I contact you in 3 days to be sure that you take the correct dose?
Yeah, definitely.
Oh, okay. Thank you so much.
Thank you. Bye.
الله ينور والله.
ده أنا very happy بصراحة.
الله ينور.
شكرا.
انت شفتيها قبل كده دي ولا انت قريتي البتاع ده، قريتي الريفرنس صح؟
يعني أخدت
عارفة
شوية
الدواء؟
وقت في الريفرنس. لا أخدت وقت، بس هو بيعمل الستيشن الأولانية بصيت على الريفرنس.
ماشي بس لا برافو بصراحة. ماشي.
ده الحل بالظبط يا شباب.
Yeah, that's أسامة. Yes, Osama. Okay, so when something like this, you come across something like this, okay, you know from the beginning you're gonna dispense this medication, right? So what is the main points for counseling? You're gonna have a look on even before dispensing. You're gonna dispense it anyways, right? We know that's counseling. You're gonna dispense it anyways. So what are the main points you have to have a look on in the reference before giving it? The indication, right? How to use administration الله ينور. safety. هو ده الكونسلنج بتاعنا صح كده؟
تمام.
فأنت في الكونسلنج area you have to look on this. I don't think you have the chance إنك أنت to look on this ones. ولا إيه اللي حصل؟ I don't know بصراحة. But if you look into the reference on this point, you would simply like solve it. Because you are so solid, you're not one of those people that gets panic. I'm trying to be rude patient, and that may happen in the exam, and you're so solid, which is really good. I was like so astonished. Okay, so he's solid. He's not like hesitant. He's confident. His stuff, and that's one of the good bits of communication you did, frankly speaking. But you missed the indication or the administration part. I believe so. Other than that, you're totally fine.
Okay, thank you.
And anyone has another comment?
Any comments? Okay.
مش اللي بعده بقى.
Excuse me, doctor. Just a question. I think you mentioned the Nasonex, like for the indications, you said to open up the airways.
Yeah. What's the problem here?
Yeah, it's just like it's not used for that, right? I just
It's not
thought
used for that.
like Nasonex, not salbutamol. Like
Yes,
it's a nasal.
Nasonex. It's a nasal spray.
Mm.
I breathe from my nose. So there is an airway in my nose. That's a very general thing. I didn't talk about my trachea or something like this, or lungs, you know, just something to open the airways.
It's
Like
a corticosteroid.
Simple.
Yes.
What's wrong in this sentence? Something to open my airways.
No, I just like I thought it can be mixed up with Ventolin, you know, as a rescue to open up the airways.
No.
Okay.
No.
No, you can use it.
No, you can use the expression. It's fine.
Yeah.
Okay.
No problem. Okay.
I have a question.
Yes, go ahead.
Because the oral layer is sublingual tablet, it was not said that it needs to be put under the tongue. Is that okay? That like it's
No,
given.
I agree with you. You're fine. You're right.
Yeah.
Yeah.
Right.
You have to put it
It's
under
supposed
the tongue.
It's not a new medication for this guy.
But
Okay.
it's not a new medication for me.
Not a
Yeah.
new
I
medication.
see. Got it. Yeah.
But I totally agree.
Okay.
You have to say like instill if it's an eye drop, like apply
Like
if it's a cream. I agree with you. Totally right.
Okay.
Yes.
Yeah. Thank you so much for that.
Okay. Did you mention the follow-up? You say it, right?
Yes,
You
yes.
They're gonna call you in 3 days to make sure. Yes, she's يعني هتزلمتها يعني بصراحة.
Okay. Any non-farm technique? Non-farm recommendation?
Yes, she said. Yes, she said about the mask. I can do anything inside as much as you can. I know it's hard, which is the empathy part, which is good. Yes, she did it.
The communication was very clear, actually, very understood. Bravo, 100 بصراحة. We can mark you as a completely solved, my friend.
Thank you.
صراحة كانت جميلة يعني. 100. Okay, very good. طيب. More stations? Are you good for now? Need more stations ولا كفاية كده؟ اوكي. طيب يلا يا جزولي، دي بتاعتك برضه يا جزولي مش كده؟ Yeah, I believe it's yours.
اوكي.
دي ما فيهاش حاجة إن شاء الله، دي كونسلنج ظريف كده وبسيطة جدا.
ماشي. Who is it? في بقى كارين شمس جبار. ماشي.
Yeah, I'm non-Arabic. Yeah, I'm non-Arabic.
What?
No Arabic Shams? Okay.
Yeah, I'm not non-Arabic. I'm from Pakistan.
Good for you, my friend. Okay, no problem.
Would you like to practice, my friend, or no?
Yeah, let's say.
Sorry?
Would you like to practice? Would you like to do this?
Yeah. I said that I want to do this.
Okay, no problem. Let's do
Are you Indian? Are you Indian?
I'm from Pakistan.
Pakistani.
Okay.
Almost Indian. Okay.
Okay. So yeah, station number 3 is we'll give him like 30 minutes and 30 seconds, and then we can start from there. Okay.
Okay, sure.
Yes, here you go. You have 30 seconds. You will find the patient profile and some over-the-counter medications on the table.
Is it possible? Can you make it bigger? Zoom it.
What?
The screen. Can you zoom it? Zoom. Yeah. Thank you.
Okay, so you have 3 over-the-counter medications, and you have the patient profile. Let's go.
Okay, sure. Hi, my name is Shams. I'm the pharmacist on duty. How can I help you?
Hi, are you the pharmacist?
Yeah, I'm the pharmacist on duty. How can I help you?
Hi, I'm here to pick up the refill for my all medication, metformin and 2 insulins. And I would like you to give me the Dexa tabs as well over the counter.
Okay, sure. Let me see what can I do for you. Just have a seat in our private counseling area. First of all, can I confirm your name and the age, please?
Yeah, I am 50 years old. My first name is Abdel Fattah, last name El Sisi.
Okay. Is it okay if I can call you Abdul?
Abdul, please. Yes, easy.
Okay, Abdul. Okay. So I can see I do have your profile. I can see that you, as you mentioned, that you are here for the pickup of metformin and 2 insulin. So I just would like to ask few questions about your medication history, okay? So do you have any allergies?
No allergies now.
Okay. And you are taking these medicines from how long?
I'm taking it from like last year actually.
Okay. And can I ask you what is the reading of your blood glucose? Are you checking your blood glucose by the glucometer?
I usually check, yes, once or twice a day. They were actually within the range, except last week. It was a little bit low.
Okay. So that means you are going in the hypoglycemia. Have you feel any symptoms for the hypoglycemia, like the tiredness and any
Not
other
for the
symptoms?
moment, but I felt a little bit shaky and dizzy.
Okay. Let me see what can I do for you. And now, are you taking any other over-the-counter medication like Tylenol or Advil?
No.
And what about the multivitamin, minerals, or herbs? Are you taking any?
I started last week multivitamins.
So have you started that one?
I just started last week.
Okay. No problem. So now I'm going to ask few questions about your lifestyle because it may affect your condition and how the medications work. So
Yeah.
do you drink any caffeinated beverages like cola, tea, and coffee?
I used to, but I stopped last week.
Okay, that's great. Just keep it up with the healthy lifestyle. And do you smoke?
No.
What about the alcohol, Abdul?
No alcohol uptake.
Okay. And do you get some time for the exercise?
Frankly speaking, no. I just started to go to the gym 5 or 6 days ago.
Okay, no problem. We will discuss it later. Okay, and how would you explain your diet?
Diet is regular, no change.
Okay. Now, Abdul, I would like to take a few moments to just gather my thoughts and I will get back. Okay.
Okay.
Can I see the over-the-counter medicine? Can I see the over-the-counter medicine page, please?
Hamad, over-the-counter medication.
Okay, thank you so much for the patiently waiting, Abdul. So as the refills are remaining, so I'm going to refill your medications. Can you back please for the profile?
Get back to profile, Muhammad.
Okay, so here, so your medicines like 20. Okay, so I can see that I am just going to refill all of your medicines like the metformin and the Nova Rapid and Solostar. And as you mentioned that you are stable on this medicine, you don't have any side effect. Am I right? Are you feeling any side effect with these medicines or no?
I don't think so, no.
Okay, that's great. So I'm going to give this medicines, and it is a good idea because so I will also explain about how all these medicines, how to take these medicines. First of all, the metformin, as you aware that 2 tablets 2 times a day with food and insulin as directed. So do you have any idea with how many units are using for the Nova Rapid and other insulin?
For the Novo Rapid, I take 10 every meal.
Okay.
And the Lantus, I take 20 at bedtime.
Okay, that's great. So just continue with this medicine And as you mentioned that you felt some hypoglycemic side effect. So it is a good idea when you are taking any insulin, the insulin therapy, and you feel the hypoglycemic, you just take care of your blood glucose regularly, just monitor it. Because if you feel any symptoms and you see that their blood glucose is going down, you just take some sugar, some honey or some sugar. But here I am just going to give you one Dexapro. Can you go for the over-counter page, please? Can you go to the next page? Over-the-counter.
Over-the-counter stuff. Scroll it down, Muhammad.
Minutes remaining. Yeah.
Scroll it down.
Okay, this test is stopped. Okay, so I am going to give you this Dexapro. So along with this medicine, if you feel any symptoms like the hypoglycemia, as you mentioned that you are always measuring your blood glucose 2 times a day. So this medicine is actually to recover you from the hypoglycemia. So you just take this one tablet under the tongue when you feel the hypoglycemic symptoms, or otherwise this medicine is just for that purpose. And for the other medicines, you just continue as usual. And as you mentioned that you are not able to do the exercise, so it is a good idea if you are going to the office, just park your car far away from your office, and in this way you just get some time to walk in and use the stairs other than the lift. So in this way, and when you are sitting in the office, you can stretch your legs and do some little exercise, just bend it. So in this way, you can cover some of the active lifestyle, okay? And for the diet, I would recommend you just, or otherwise you just go for the diet that are low in carbohydrate, high in the protein, and good in the fibers, like more vegetable and the fruits, okay? And meanwhile, I would recommend you just keep your vaccinations update, like the annual influenza vaccine or all other vaccinations, okay? So all these things make sense, Abdul?
It makes sense to me.
Okay, Abdul, do you have any other question?
No.
Time.
Okay, Abdul. Okay, Abdul. So I will just give you a call after. Yeah, I will give you a call.
Okay, thank you. Thank you, James. Okay. Can anyone try it as well with us?
اوكي جزولي ممكن نعمل لها assessment دي عشان لسه عندنا 3
We can do assessment. Okay, no problem. We can do assessment. Shams, it's not fully solved, unfortunately. Why? Because it's missing so many things. So did you? Okay, you asked me about the symptoms of the hypoglycemia. That's right. Did you ask about the readings? That's number one. You didn't ask about the readings at all. You didn't tell me when you give me the Dexa. You didn't tell me how to do it. You just told me you can put one under the tongue and that's it. No, it's not one under the tongue. You should have 15 grams to 20 grams, which is 4 here, four pieces, and then after 15 minutes you're gonna check. And if it should be above, you have to give me numbers. You have to be assertive.
5 to 7 and
exactly.
Like 9 to 11.
If not, you have to take another 4 pieces or 5 pieces, and then you check back again. Don't do any activity during this time because that's dangerous. Did you ask me about if I got any pass out or something? If you ask me, I would say yes. I did passed out once in the gym. That means that I'm here. I'm seeking something extra, more than the Dexa. Here, Baqsimi is a must because I passed out, right? Number 2, you didn't mention anything about like a bracelet.
Sorry,
or
say it
something.
again. What is passed out? Sorry.
أغمى عليا.
أغمى عليه. Okay.
Yes. Management of hypoglycemia is different from being like hypoglycemic with like conscious and unconscious. There's a difference. Okay, I was unconscious for once in the gym. So that's a big difference. And he didn't ask about it. So he has to ask about if there's any unconsciousness happened or no. It happens, yeah. Okay. He has to, for patient care and follow up, he has to tell me, okay, you have to go by bracelets so people know if I pass back again, so people knows what's happening. He didn't mention this also, right?
Yeah.
So that's my comments. I believe from a communication point of view, it was a one-sided communication. He just said you have to do so and so and so and so. And I said, okay, is it okay with you? Does it make sense? I'm like, okay, it makes sense. However, he missed some other criteria he has to mention. Any comment? Someone want to add? Let me know.
تمام.
Okay, Shams, was it clear? You got my comments?
Yeah, I got it.
Okay, so make sure that you give in blood pressure cases or diabetes cases, you have to ask about numbers, and you have to give me numbers too, right? It's not like symptoms and that. You have to give me numbers. Okay, and don't forget about the unconsciousness. If this happened, that's going to be a different story as well, right? And the way you handle it is going to be different. Okay, my friend. So that's a very small points, but they're important. Okay.
And is it okay to tell the patient hypoglycemia? Is it lay language?
Low sugar levels, yeah.
Yeah, okay.
Can I ask a question? Like he say he stopped the coffee 1 week ago. Is it a reason for hypoglycemia?
Sorry, what did you say? Sorry?
I think he said he stopped caffeine last week. So is it a reason for hypoglycemia, like to affect the insulin level?
I stopped everything and I started to be healthy, follow a healthy lifestyle. And I told him I started to go to the gym last week too. Right? So I'm trying from my side to be like following a healthy lifestyle. That's it.
Very good.
Her question is about the hypoglycemia. Is it the caffeine stopping is the reason?
Caffeine is not related to, no. I don't think it's related. Caffeine is not related.
Okay, and regarding the Lantus, it's the last refill. So do I have to fax the doctor for another prescription for the patient for the next refills?
Why?
It's the last one, so I will gonna give it to him today. So he will need in the next visit to another prescription.
No problem, you can do it.
Okay, no problem, you can do it.
That's the problem, no problem. Go ahead. Okay. Clear؟
تمام.
تمام؟ فل. أي أسئلة؟ طيب ستيشن 4. ستيشن نمبر 4. يلا بينا. One moment, guys. اوكي وصلكم يا شباب؟
وصل.
تمام، بعته على الواتساب جروب. طيب يلا بينا. هحاول افتحه هنا برضو. قلنا ستيشن 4. اي نورفاسك. طيب انت مش محتاج يعني النورفاسك قوي يعني، غير لما تشوف المعلومة اللي انت عايزها محتاجها بس تبص عليها يعني. Okay, so let's start. 30 seconds. جازولي انت معاك الوقت؟
مع الوقت طلع.
طيب يلا خد 30 seconds. احنا 30 seconds بص يا شباب انا اوضح حاجة بس. اوكي ال 30 seconds اللي بنقول عليهم هنا دول ممكن ما بيبقوش عندك في الامتحان فعلا زي ما شمس قالت كده. اوكي بس احنا بنديهم عشان احنا بنتكلم هنا على الماتيريال اونلاين وبتاع وحاجات نيوميريكال يعني، حاجات ديجيتال. فالحاجات دي ممكن بتكونسيوم وقت شوية عن لما تبقى حاجة هاندد في ايديك. اوكي فهمتوا؟ فده الغرض ان احنا بندي 30 ثانية بس، لكن هو في الامتحان ممكن ما يديكش 30 ثانية او حاجة. تمام؟ طيب يلا بينا.
ومين اللي هيشتغل الكيش ده؟
مين؟ ما حدش هيشتغل لسه. Who's gonna do this station? who's gonna do the station?
أكرم.
فين يا أكرم؟ يلا يا أكرم. يلا يا أكرم. يلا يا أمل. يلا يا أسماء.
Karen will do it.
شمس. كارين. فرزانة فتوهي.
I can try.
I
هو
can also try.
ليا.
Yes.
No problem.
يلا ليا. Okay, good.
Yes.
So let's start. Here we go. Station number 4. 30 seconds ago video. Okay.
Yes, 30 seconds.
You have a prescription and you have the patient profile.
Okay.
Good. Here you go. Good.
Go ahead.
Okay. Yes, hi, I'm Leah. I'm the pharmacist on duty today. How can I help you?
Yes, Leah, I have a new prescription. Dispense it to me, please.
Yes, sure. Please have a seat. And this is our private counseling room. So whatever we discuss will be kept confidential. Okay, so this prescription is for you. You're Boris Johnson.
Yeah, exactly.
Okay, so can I address you, Boris?
Yeah.
Okay, Boris. So for what reason you visited the doctor today?
It's my blood pressure always.
Okay. I'm sorry for this. So it's not controlled?
Yeah, no, it's not.
Okay, so the doctor prescribed to you Norvasc, which is amlodipine 10 milligram. Is it the first time today to take this medication?
Yes. Yeah, first time.
Okay, so I'll need to ask you a few questions to give a proper counseling. So your age is 49?
Yes.
Okay, and do you have any allergies?
No.
And do you have any other medical conditions I should be aware of?
I have many.
Okay, I can see you're taking a lot of,
check my
yes.
file.
So you're taking all your medications as prescribed?
Yeah, I'm taking them in a blister bag. It's a blister bag.
Okay, that's good. So is there any side effects? Is it controlled?
So far, so good.
So just for the blood pressure, right?
Yeah, blood pressure is not well controlled.
Okay, and do you take any over-the-counter medications like Tylenol or Advil?
No. Only when needed or something, but not every time.
Any herbals, vitamins?
No.
Okay. So I need to ask you a few questions about your lifestyle, as sometimes it can affect your condition. Is it okay with you?
Yes, go ahead.
Okay, so do you consume coffee?
Coffee? Yes, I drank.
Okay, how many cups per day?
2.
Okay, and what about alcohol?
Well, only on occasions.
Okay, and do you smoke?
No, I don't smoke.
That's good. Do you find it time to exercise?
I walk.
Okay, and what about your diet? Is it balanced?
I think so.
Okay, great. So could you scroll up?
Nothing. So you have nothing, only the blister pack.
Yeah, okay. Okay. So your main concern is to fill this prescription, right? Do you have any other questions for me?
Thank you, my friend.
Okay, so just give me a few moments, check my reference, and I'll be back.
Yeah, go ahead.
Can I see the prescription? Mm. Okay, so
Yes.
so Boris, when is your next appointment with the doctor?
1 week, 1 month or 2, I don't know.
Okay, so we will be starting this medication, amlodipine, in the strength of 10 milligram, and I will put it in the blister pack for you.
Very good.
So yeah, you need to take it 1 tablet once daily.
2 minutes left.
And okay, and I will
Any side
I will
effects of this medication?
yes, sure. You may experience some side effects, or you may not, like dizziness or reducing in your blood pressure. So you always have to monitor blood pressure. And also we need to monitor the blood pressure to be under 140 over 90. Okay, so I will give you a log to always keep like your numbers on it.
Okay.
Is it okay with you?
Yeah.
Yeah, so I will be putting the amlodipine at night.
At night, okay.
Yes, so if there is any side effects or dizziness, you can take it at night. And also this is the first time taking this medication. So if you experience any allergic reaction like swelling of the tongues and lips or rash all over the body, I recommend stop the medication and go to the
What
emergency.
time? After how long should it give a good effect on my blood pressure?
Oh, it will not give the effect right away. It will need some time. So we need to be patient, okay?
For how many time? Like for how long? Excuse me. Like in 1 week, 1 month, 2 months? I don't know.
Yeah, it may take like a week. So we need to start it like and monitor the blood pressure and keep up with the monitoring the blood pressure and seeing the doctor. And you can give us a call whenever you need, so we can discuss anything if any side effects happen to you.
Okay. Yeah.
Okay, and
Okay.
it's finished.
Hey,
Okay.
I like it so much, your counseling, actually. You give a very good counseling, but you didn't get it, my friend. You did
Is
a
it started the
you did a fatal
yeah.
mistake. You did a fatal mistake. Okay.
Mm.
So we have 2 options here: either to
I have a
retake it,
question.
to retake the station with another candidate, with another colleague, or we can go right away to the assessment. What would you prefer?
Go
Can I
right
attempt
away.
this?
Hmm?
Can I attempt this?
Go for assessment, Amal. Go for assessment.
Assessment. Okay, so let's go for the assessment. Okay, what is the problem here? You can do the assessment by yourself.
10 milligram is too much.
Yes, this is number 1.
Amlodipine and nifedipine in the same patient.
Yes,
Exactly.
number two. The patient
And
taking
it's
the-
already 2 tablets
you
at night.
didn't
He gave
eat-
it in the morning.
Exactly. You didn't even go through the blister pack. Okay, this is
Yeah, because it's
here
too
they
long.
have they have the nifedipine here. This is number 2. So number 1 is the dose. It's not the right dose to start. You have to start by a lower dose, like 5 or 2.5, if the patient is fragile and can get dizzy very easily. So you can go for 2.5. If not, so you can start by 5. Okay, that's it. Number 1, as you said, it's preferred to take it at night for first week or something. Afterward, you can get the dose in the morning if the patient would find it comfortable to him. But at night, yes. What about the side effects from amlodipine? How much
Edema.
common side effect? Yes, leg edema, number 1. Dizziness, number 2.
Constipation.
Yes, you can see that. What else? Common side effect is
Gingival hyperplasia.
what?
Gingival hyperplasia.
Hyperplasia?
Gingival hyperplasia, the mouth, the gums.
No, it make
No, it's not common at all. That. No,
Angioedema?
tachycardia. It make
headache.
tachycardia.
Headaches, guys, headaches. Okay, it's headaches. Okay.
I believe vasodilator, we focus on headaches, I believe.
Yeah.
Headache, flushing.
Exactly. Okay.
Yeah, edema sometimes.
Headaches, leg edema, headaches.
But it's okay to just say two side effect. Is
Yeah,
it
one or
enough?
two side effects are enough. Yeah.
Yeah.
Side
Okay.
effects are more than enough. Okay.
Mhm.
Like the leg edema, maybe the headaches, dizziness. That's it. Okay.
Mhm.
So if we're gonna give a counseling about this medication, can you give a counseling in the 4 steps that we said? Indication, safety, efficacy, compliance. Can you say it in about 30 seconds? Can you give the counseling, a proper counseling of this medication in 30 seconds? Who can do it?
Can I do?
Go ahead.
Yeah. Okay. So doctor have been prescribed you the amlodipine with the strength of 10 mg. So this brand name is Norvex and medicine name is amlodipine. You are going to take 5 mg, means half tablet right now, and after 1 to 2 weeks we can just increase titrate the dose to see your blood pressure. You have to monitor your blood pressure twice daily, and usually this medicine is well tolerated. There are some side effects which you may or may not experience. The most common side effect is the headache. For that one, you can take Tylenol 1 to 2 tablets if required, if this is not tolerable. And leg edema, so for that one, you just do some light exercise, and that's it. Okay. And as you are taking this medicine very first time, so maybe you are allergic to this medicines. If you feel any difficulty breathing, swelling, and swelling of lips and tongue, just go to the emergency. Maybe you are allergic to this medicine. Okay, so I just give you a call after 1 week just to see that how your blood pressure is, and just keep up with the doctor's follow-up appointment because it is very important for you.
Okay, very good. You have you mentioned the effectiveness part, which is in how many days, how many time, how after how long should I expect a positive result, a positive reflection on my blood pressure?
It is 1 to 2.
No.
What?
1 to 2 weeks, he said.
Yeah, maybe yes. You can say that actually. 1 to 2 weeks. According to the CTC or something, it may take up to 4 weeks.
4 weeks, yeah.
Yeah, but usually in lifetime it's after 2 weeks. Okay, you can up to 2 weeks. Within 2 weeks, you can start witnessing a positive effect on your blood pressure. Okay, so this is a counseling. Very good counseling. Okay, so that's it. Okay, so take care of that nifedipine. You cannot give both together. Here you have to ask the patient, did the doctor told you anything? Did the doctor told you anything about tell you anything? بيت أم كده. Did your doctor tell you anything about the medication that you are taking? Any change in your medications? Yes. The actor would say yes. He told me to stop one of my medication. I don't know which one. So can you help me? هتلاقيه هو النيفيديبين. Okay. That's it. تمام. في حاجة تانية كمان. Have you noticed any medication that could negatively affect the blood pressure?
فينالاكسين أكبر من 225.
Clonazepam?
Number 1.
Methylphenidate.
Methylphenidate.
Exactly.
والفينالاكس, yes.
You have 2 medications. Here is an extra mile to go if you would like to do like something extra in the station. What about the venlafaxine? Is it effective for you? Who told you yes, it's effective? Would that would bother you if we can change it to another medication that may help us in controlling better your blood pressure? He would say no, you can go. What would you recommend? So you can propose another thing. What about the escitalopram? Okay, citalopram, anything. Okay, this would be a good idea. What do you think?
Yeah, very good.
Yes, that's it. Okay, so this is like as I said, it's like a bonus point. اوكي فينلافاكسين والكونسيرتا بياخد الاثنين مع بعض، فده ممكن طبعا بيكون بيأثر على البلاد بريشر بتاعه. يبقى كده لا you can propose ان انت تغير الدواء ده، ليه لا؟ هو بياخد 300 مللي جرام صح؟ مظبوط.
سوري يا دكتور معلش عندي سؤال.
اتفضلي يا ريس.
هو أنا دلوقتي هو أصلا كان بياخد النيفيديبين غلط، كان بياخد حباية واحدة بدل 2 وكان بياخدها الصبح مش بالليل، فالمفروض إن أنا أصرف له الدواء الجديد ولا أقول للدكتور أصلا إن هو كان بياخد ده غلط فعشان كده ممكن يكون ضغطه مش مظبوط؟
والله as you like as you like، بس هو يعني ما زي ما انت عايزه.
اوكي
تمام. ممكن ده يعني 30 برضه هي therapeutic dose على فكرة 30. هو you can go up to 60 صح؟ هو 30 بس هي therapeutic dose. ماشي؟ المهم ان هم ما يتاخدوش مع بعض يعني ممكن تبروبوز على فكرة، ممكن صح اللي انت بتقوليه ده فعلا، ممكن تنكريز still you have a room to increase the dose up to 60 milligrams.
Okay. Thank you, doctor. Yeah.
So here we dispense, or we need first to stop the nifedipine?
You have to stop the nifedipine.
Okay. We'll fax the doctor and then.
So what you're gonna do? You're gonna stop the nifedipine. You're gonna dispense the amlodipine in a lower dose, like 5 milligrams for 1 week. Then you can increase it to 10 milligrams. Okay. Half a tab. Take half a tab for 1 week. Then you can take a tab complete. Okay. Afterwards, for venlafaxine, as I said, you can propose stopping the venlafaxine or switching to other medication that may not negatively affect the blood pressure. Okay. كونسيرتا برضو كذلك نفس الموضوع.
يا دكتور معلش سوري، أنا عندي دلوقتي medical condition controlled 2، يعني أنا هقترح إن أنا أغير دواء على medical condition already controlled، هدخل في دوامة إن يبقى عندي بدل الهايبرتنشن بس هيبقى عندي hypertension depression and ADHD إن أنا أظبطها.
Did you ask about if it's controlled or not?
Which one?
I didn't ask.
الاثنين.
أنا ما عملتش كيس بس المفروض بس هي قالت له.
You said it's a controlled. You assumed إن هم controlled. Did you ask إن هم controlled?
اوكي لو مش كنترولد هنعمل ايه، ولو كنترولد نغيرهم يعني لو كنترولد.
هو هنا الفيلا فاكسين احنا عارفين ان هو more than 225.
أيوه.
It has a contribution in the blood pressure صح؟
That's right.
Yeah, if you can advise if you can to a better a medication that has no contribution to it, it's fine. You can advise. You're not gonna change it. محمد هنا كان بيقول you're advising to switch it if that possible. تمام. So concerta has contribution ولا لا؟ has contribution طبعا.
Yes.
You advise the patient. على فكرة أنت بتاخد 2 ميديكيشن والاثنين بيأثروا على البلاد بريشر. الكونسرتا ينفع يقف ولا لا؟ ينفع يقف من الميديكيشن اللي تنفع يحصل لها فاكيشن صح ولا لا؟
صح.
Exactly. Being in a blister pack, that means it's a chronic medication. A Concerta is not that kind of medication. It can be taken as a vacation, right? You can tell him, ask him. The question, okay, is it for how long have you been taking it? You know, all this is a patient care. It's a good question that you said, my dear. But you have, to give exact or to give like an absolute answer to it, you have to ask more deep questions. So you can decide at the end if it's okay. You know what? You have been on this for like so long, and you're okay. Did you ask about your doctor about like having a vacation from this medication? Maybe he said yes. Maybe he said no. You know what? Deprescribing is one of the good practices as well, by the way.
أيوة. تمام. I agree, but you know, for the 7 minutes I have, do I have time to do all this?
You can have time. That is not core of the score. It's a bonus. That's what Muhammad said. It's a bonus.
تمام.
Yeah, exactly. But if you have time, This is an options that we are discussing that you can discuss or you can use. Sometimes you finish the station within like 5 minutes or so, and you have nothing to do. You're still silent, but still you can take the extra. You know what I'm saying? It's a good. It's a
Yes,
good.
yes.
It's a good brainstorming that we are talking about here. You know.
Okay.
Okay. So
Thank you, doctor.
It's not mandatory, guys. It's not mandatory to change the venlafaxine. But usually, if he's controlled with 300 milligrams, so it's not resistant depression. So it's not resistant. You can still change. He may be. He may get controlled with citalopram 20 or 40 milligrams. Okay, but هو
something can be considered.
Yes, هو مش resistant هنا. ما دام هو controlled وكويس وزي الفل خلاص ما عندوش مشكلة. ممكن لو عايز تسأل هو خد أدوية تانية قبل كده، بس دي قصة بقى هتدخل في دوامة تانية يعني.
تمام. اوكي، شكرا يا دكتور.
cut it short يعني. هو دي بس حاجة أنت بتلمح لها، بتبين له إنك فاهم. أنت بتبين للأسيسور إنك فاهم إن في مشكلة هنا، ممكن يبقى هو الفينلافاكسين. اوكي، قرار بقى إنك تغير ما تغيرش مش بتاعك أنت، بتاع الفيزيشن بس، فأنت بتاخد القرار معاه. طيب.
شفنا 5.
Yeah, that's a very good station. It's a very good station and a simple one. It's a simple one. يلا بينا, no reference in this station. يلا بينا شباب. No 30 minutes allowed. No 30 seconds allowed. يلا مين معانا؟ Who's next?
Yes.
محمد صالح.
ازيك يا احمد صالح؟
الحمد لله بخير تمام فاين.
انت من الشرقية ولا ايه؟
لا من اسكندرية.
منين من اسكندرية؟
أنا من سيدي بشر.
إيه ده أنت جاري؟
قبلي ولا بحر؟
فين في سيدي بشر؟
جمال عبد الناصر.
جمال عبد الناصر، أنا برضه جمال عبد الناصر.
قدام الأكاديمية.
ده أنا حماتي هي اللي هناك بقى. هي اللي قدامك.
أكيد أعرفها بقى.
أنا صيدلة 2000.
ده لا فين؟
لا مش
أنا
2000.
أنا 2008.
لا أنا قديم شوية.
أنت فين يا باشا؟ في سيدي بشر بالظبط قلت لي؟
بس حاليا في أوتاوا.
إيه ده أنت في أوتاوا كمان؟ جنبي. أنا في كاتنا.
ماشي يا سيدي خلاص. يعني محمد يعني بروح عليك يلا. قدرنا ده الراجل ده طلع معرفة.
هو داخل برضه داخل منشن على الستيشن السهلة برضه.
والله أنا ما أعرف والله. أنا مش عارف.
الله معاك يا باشا. يلا احنا جيران في اسكندرية. طيب يلا بينا. Let's start. جازولي Okay, Gazuli, you're gonna watch the time?
Yes, sir. Let's start.
يلا بينا مستر صالح. Yes, hi.
Hi, this is
I have a new prescription.
How may I help you today?
I have a new prescription. I would like
to... yeah, it's my pleasure to dispense it for you. Just have a seat in our counseling room where we can discuss everything in a confidential setting. If you just give me enlarge the prescription because I can't see it clearly.
Yeah.
Okay. Yeah. So how may I address you, sir?
Zelensky.
Oh, so you are Ukrainian.
Yes.
Okay. How old are you, sir?
I'm 45.
So, Mr. Zelensky, I see the prescription came to you. It has, as far as I see, three medications. The Vegamox, which is an antibiotic, to be taken 1 drop in the right eye for 7 days, and Nevenac, which is like an anti-inflammatory to be taken for 3 weeks, and Breadfort, which is as another anti-inflammatory, steroidal anti-inflammatory to be taken in a specific sequence. May I ask you a couple of questions before dispensing this medication to you?
Go ahead.
Yeah. What's the medical conditions that that you haven't and you're taking this medication for?
I had an eye surgery in 2 days.
In the coming 2 days, right?
Yeah.
Perfect. This is a cataract surgery?
Yeah.
Okay, perfect, perfect. I hope it will be a successful surgery, and I believe it's going to be good for your eyes and it will improve your sight a lot.
Inshallah.
Inshallah, yeah. Do you have any other medical condition?
Yes.
What other medical condition do you have?
Hypertension.
Hypertension. Okay. And do you take any medication for hypertension?
Yes, and it's well controlled.
Okay. Do you take any other medications?
No.
Other hypertension one? No or supplement. Are you taking any supplements or helpers?
No.
Any over-the-counter medications?
No.
Okay. So regarding your lifestyle, do you drink any caffeinated beverages?
No, sometimes, but it's not so often.
Okay. What about alcohol consumption?
I drink about 1 cup per day.
Okay. And what about your diet? Is it?
It's good one.
Perfect. And do you exercise?
No.
Okay. I hope after this surgery you start doing some exercises. This will improve the whole body and the blood circulation in your body, and this is very, very helpful for your health. Just yeah.
Go ahead.
A question for me?
Questions? No, I need my medications.
Okay. So as far as I see, this is a normal regimen to be taken for cataract surgery. The Vegamox or the moxifloxacin is an eye drops, and it should be taken 1 drop in the right eye, which is the eye that you're planning to do the surgery in. That's right.
Okay. Yes.
This is the right eye. The right eye is the one that you're going to do the surgery in.
Yes, the right eye.
Okay. Perfect. So you will start taking 1 drop on the right eye 4 times a day for 7 days. This is the whole prescription. There are no instruction on when to start in the prescription, because I just see from Vegamox till Dr. Carly Johnson.
Okay. Yes, exactly right.
Yeah. Okay. So this is for the antibiotic one, and the other 2 eye drops is Nebefenac, which is to be taken 1 time per day for 3 weeks.
2 minutes left.
And the third, as we discussed, is the Predfort, the third eye drop, which will be taken also in the right eye for a sequence, starting 1 drop in the right eye 4 times per day for 7 days, then 1 drop 3 times a day, and then you will take for 7 days, and 1 drop in the right eye for 7 days, 2 times per day for 7 days. Then it will end up by taking 1 drop in the right eye 1 time per day for 7 days. Anyway, there is a very important technique that you should start using it for the eye drops that you're taking. You should start with the Predfort as the first one to use when you start taking the 3 eye drops together. And then it will be followed by the Vegamox, and it will end up by the Nevenac. The way to take the eye drops is just to make a pouch in your eye in your lower lid, and put the drop into the eye, and you can just look upward without moving your head and look downwards, so the drop itself, it can be distributed into your eye in the right way.
Okay, so what I'm gonna do? I'm gonna start with the Bridgeford.
You will start with you will start with the Vegamox. With the Vegamox, and then with the Bridgeford, and it will end up by the Nevenac.
Okay, 4 times daily.
Yes, you will start 4 times daily with the Vegamox, and for the Bridgeford, you will start in the first 7 days with 4 times daily, and Nevenac, it's all over the time. You will take it only 1 time per day.
Okay, good, good.
This medication is very common during the
Okay, good, my friend. Not so bad. Okay, not bad. Okay, it's very good, But you okay. So you're gonna start at the beginning. You told me that I'm gonna start with Bridgeford.
Yeah, it should be with the solution first, then the suspensions.
Okay, how many minutes should I space out between?
Yeah, should be spaced by 5 minutes, I believe, as far as I know.
You didn't say it.
Yeah, yeah, you're right.
You didn't say it. Okay, this is number 1. Number 2, you didn't mention the duration of treatment, I think.
No, I said every 7 days.
For Nevenac, you said for 3 weeks?
For 3 weeks.
You said that?
I believe so. I'm not sure.
No, you didn't.
Okay.
Didn't. Okay, you didn't for Nevenac. For moxifloxacin, I think you say that.
I said, I'm sure for Vegamox and the Bridgeford.
Yes, maybe. Okay. For Bridgeford, you said, yeah. You said that step 6. Right? Okay, anyhow. Okay, so this is like a little bit confusing situation, but you have to be well structured in that. So you're gonna start. What you're gonna start with?
Vegamox.
Yes, sir. You have three different types of the eye drops. You're gonna start for the first week. For this upcoming week, you're gonna start with 2 eye drops for 4 times daily, which are the Vegamox that you are gonna instill first or put it first. 5 minutes later, you're gonna put the other one, which is the cortisone.
Yeah.
Which is the cortisone. Okay. For this coming week, you will apply it 4 times daily. For the Nevenac, you don't have to apply it. You only have to apply it once per day, and this is gonna be for 3 weeks. That's gonna be for 3 weeks. This is the total duration of treatment.
Yeah.
That's it. خلاص يبقى انت كده خلصت من نيفاناك.
حلو.
خلاص. Okay.
I have a question.
Sorry, doctor, can you repeat the dose?
4 times daily.
لا, I mean, يعني you say you will start with 2 and you will leave the Nevenac.
Okay. مش فهمت قصدك ايه بس ماشي هقولها تاني. So for this coming week, you're gonna start with you will apply 3 different types of eye drops. 2 of them, which is the Vegamox and Bridgeford, you will apply 4 times daily. Usually we will start by the Vegamox, okay? And 5 minutes later, you will apply the other one, the cortisone. For the Nevenac, you only have to apply it once per day. And for the Nevenac, you will continue in the same manner for 3 weeks. Okay, that's it. For the other 2 weeks, after 7 days, you will drop out the Vegamox and you will continue the Bridgeford in a descending manner. Okay, so you will start by 4 times daily for this week. Next week, you will go down for 3 times daily, then 2 times daily, then once, and afterwards you have to stop it. Okay, that's it.
I have a question. Why is the Nevenac is an ophthalmic suspension and then it says take 1 tablet for once daily for 3 weeks? It's supposed to be. I'm not sure. Why is it like that?
What is 1 tablet? Yeah.
Like,
yeah. No. It's like It's like
it's a mistype, I believe.
Yes, it's like erratum. It's like erratum or something. Okay, we will, yeah, here we go. تمام.
Yeah,
Should
correct.
be fine. Yeah, it's fine like that. Okay, my friend.
Perfect.
That's it. This is a very, very common prescription, by the way, for the cataract surgery. Very, very common. تمام. Should we keep the eye drops in the fridge or what?
Not for those.
Not for those. Okay. So the storage is very important. For the
Yeah,
eye
but
drop.
I have a
So we
question
have
here.
Yeah.
Sometimes I hear that we can keep the eye drops in the fridge just to make them cold before use. I don't know if that's I
مش
to be honest with you.
مش لدول. بص مش لدول. الحاجات بتبقى الحاجات اللي هم بتوع الالرجيز دول. لو بيبقى واحد بيبقى عنده دراي ايز ولا عنده الرجي ولا عنده
مظبوط صح
لا بتحطه عشان تبقى ساقعة كده فترطب شوية يعني.
اوكي
تمام. بس ده احتمال يعني.
طب معلش انا
بس
عندي
انت
سؤال.
كده
هو
كده انت كده كده المفروض بتهز البتاع برضو بين ايدك عشان مش المفروض ما تبقاش ساقعة قوي يعني. انت فاهم؟ بس قول يا باشا، اتفضل. حد عنده سؤال؟
النيفاناك ليه مش مكتوب ان هو رايت اي؟ لايك
معلش سامحوني.
لا سوري، انا فاكره ان هي فيها بس
هي
حاجه.
مش
طب for the suspension I have to say he should shake it.
طبعا كنت لسه هقول الحته دي.
And he have to discard the like the ophthalmic suspension and everything after 1 month.
Yeah, 28 days. Yeah, 28 days. تمام. بس الحاجتين دول مهمين جدا في اي دروبس. تمام. يبقى هي تهز البتاع كويس وتحط. وفي حاجه تانية مهمه، ايه هي؟
نضغط على الانف.
ايه؟
نضغط على الانف عشان الاورال absorption.
ماشي. لا في حاجه تانية اهم.
Don't make the tip of the eye drop touch the eye or anything.
الله ينور عليك. 100 صح. اوكي. That's it. اوكي. في اسطمبه كده من الكونسلنج لازم تقولها كده. ترمي البتاع بعد 3 ايام. نمره 1. نمره 2 لو سسبنشن تهزها. طبيعي انك تقول له هز الاي دروبس وخلاص يعني، مش هتفرق سواء سسبنشن او سوليوشن. قول له هز البتاع وخلاص. اوكي. نمره 2. نمره 3 ما تلمس عينك. So number 1 shake the bottle او shake the مش عارف اسمها بيسموها ايه the eye drop. بيسموها ايه بتاع العلبه دي؟
دروبر.
ايه؟
The tip of the bottle. The tip of the bottle.
Dropper, yes. Shake the dropper well before the usage. Number 1. Number 2. Dispense. You can dispose the dropper to 4 weeks after the first opening. Number 3. Do not ever touch the dropper tape to your eyes. تمام؟
بتقولوها ازاي بالفرنساوي دي في كيبيك يا محمد؟
ايه؟ انا بحاول بترجمها والله من الفرنساوي في
بالفرنساوي دي في كيبيك.
ايه؟
بتقولوها ازاي بالفرنساوي في كيبيك دي؟
ده قصة تانية بقول لك بعدين. انا بحاول اترجم الكلام فبقوله بالشكل ده. طيب اوكي جود. تمام. يلا بينا. يس هير وي جو. ستيشن دي حلوة بصراحة. ستيشن 6 دي انا بحبها. اخر ستيشن ختامها مسك. Here we go. We have a question here. When the patient need to start the treatment right after surgery or مش عارف ايه. Yes, usually in some setting, the patient may need to start 2 days before the surgery, right? And sometimes he may start taking the antibiotic and taking the Nivanac 2 days before the surgery. Okay, but here it's not mentioned. So he should start right away after the surgery. تمام. يلا. Station 6 is a very good station actually. I like it. and it's a new station بصراحة احنا عاملينها يعني هتعجبكم بالأمانة، وهي على فكرة بتيجي في الريل لايف كتير أوي. طيب يلا بينا. مين سعيد الحظ اللي هيقعد ستيشن نمبر 6؟ Yes, who's next؟ 348 552 تاخد الستيشن دي؟ 348 552 Karen, you have the mic. Karen A. عندنا 3 ايفون ما شاء الله. Guys, we need a volunteer, guys.
I can take this one.
I'm volunteer.
Hi there. Yeah, I can take this one.
Why? What's your name? اسمك ايه يا باشا؟
My name is Mian.
Oh, yes. Okay, good. يلا جزوري.
Yeah, the reference. I'm not sure if.
Yeah. You have a reference. Yeah, I'm gonna share it now. Station number 6. Here we go. One moment.
I'm getting nervous.
What's your name? What's your name again? Sorry.
My name is Mian.
How can you spell it? Can you write it?
It's MHIANN.
Oh, Mian. Okay.
Where are you
Right.
from, Mian?
I'm from the Philippines, but I'm here in Canada right now.
Oh, okay.
Okay.
Yeah. Okay. So are you ready?
Yes.
Okay, let's start.
You got the reference, right?
Yes, I got a reference.
Okay, good. يلا عم جنزوري هفتح لك التايم. اوكي.
Yeah. نزل scroll down station.
Here we go. Yes, let's start, my friends. 1 2 3. Yeah, خلاها. Okay.
Hello, may I speak to the pharmacist?
Hi there, I'm Mian, the pharmacist. How can I help you today?
I'm here to pick up medications that have been sent by the doctor. They told me that it is ready, and I'm here to pick it up.
Okay, yeah, sure, I can help you with that. The patient's name is Justin Trudeau. Is this for your? I believe it's for your son, or I'm not sure who is for.
Yeah, it's for my son. That's true.
It's for your son. I see, and he is 6 years old, right?
Yeah.
Okay. So, does your son? Okay, I'm gonna help you with that. I'm just gonna ask a few questions about his allergies or medical conditions. Is that okay?
Yeah,
Okay.
definitely.
So does he have any allergies?
Yeah, he has some allergies. He has cephalexin allergy, peanut allergy, sulfa allergy.
Okay. So what happened when what are these allergies? Do you know? Like is it like just intolerance, or what happens if he eat like peanut or sulfa or sulfalexin? What was the reaction to that?
Some itchiness.
Itchiness for the three of that, the peanut, sulfa, and sulfalexin? Yeah. Okay. Itchiness. Okay, so like all over the body, you're saying?
Not all over the body, the trunk area. That's it.
And it's really itchy and like hives, is that what you mean?
What do you mean by hives?
like some rashes that he like encountered.
Just itchiness, some itchiness.
Some itchiness. Okay. Okay. So okay. Let me see here. Okay, so the doctor prescribed a medication for Justin. Why is the doctor's prescribing this medication to him? You know?
Yeah, he has infection in his ears.
Mm-hmm. Okay.
And the doctor said you have to go get. I believe it's an antibiotic. I'm not sure.
Yes, it is an antibiotic. Yes.
Yeah, so it is the best option for his situation.
Yeah. Okay. Okay. So does Justin taking any over-the-counter medication and stuff like that?
No, he doesn't.
Okay. And yeah, so infection, I see. Okay, so what infection again? Like, do you know what infection is we're treating here?
Yes, it's for his ears.
A ear infection, I see. And does Justin use any medication before or no?
No, this is whenever used any medication before. No.
Okay.
And it's actually it happened once before actually, and it helped it.
Okay. And when was that? When was the last time that you had this ear infection?
It's 6 months ago, I believe.
6 months ago. Okay. Okay, let me just check. Okay, let me just 6 months ago. Okay, let me just double check my reference and I'll get back to you, okay?
Yes, no problem.
Sorry, I just want to know how many kilograms is your son?
It's on your file, on his file in front of you.
Oh, it's sorry.
It's written on his file, I believe. This information.
Right.
Can I take the bottles of the antibiotic because I have to go, and he's sick?
Yeah. I'm just gonna calculate on how many meals am I going to give Justin, just to make sure everything will be the correct dose for him. Okay.
No problem.
One minute remaining. So 1.5.
Okay, so so there's a medication here. It's an antibiotic for your son, for Justin. And I would believe that he would need like 5 meals twice daily for 14 days. He needs to take this usually with food, because this medication is can be will be given him like a stomach upset, or like diarrhea and stuff like that. So need to be taken with food. Even though his
Is it ready? Because the guy said it's ready. 2 bottles are ready for me to take it. Is it ready or no?
Yes, it is ready. Yes, it is ready.
Okay. Okay. So now you're telling me how to take it. Okay, no problem.
Yes, that's right. Yeah, it's ready. So there are 2 bottles here, 150 ml in each.
So how are you gonna take it then? How are you gonna take it?
Like give 5 ml twice
Okay.
daily for 14 days.
Okay. Should I shake it?
Yeah, yeah. Sorry, just before every time you give the dose for the patient or to Justin, you need to shake first.
Is it with or without food?
With food. It's supposed to be with food.
Okay, amazing. Anything I should be aware of? Anything I should be aware of?
Okay, so he is allergic to cephalexin, like some itchiness. So this medication is like an amoxicillin plus clavulanic. So just be aware. I'm not sure if that's intolerance, if it's itchiness, or it's a real like allergy with Justin. But if it happens to have like he's having
I'll
like
watch out.
a swelling of lips.
Yeah, I'll watch out definitely. No problem. Thank you so much.
Anyway, yeah, I had a hard time. Like,
thank you so much.
Time is over.
Time is over. Okay. Is there anyone want to do it, or we should go for the assessment?
أنا ممكن أقول المشكلة بس
لا أنت تقولي الستيشن معانا. إحنا عارفين المشكلة. أنت you have to practice my friend. المشكلة معروفة. The problem is so obvious. So we need you to practice with us. Is it okay with you or no? Okay, thank you so much. You can participate now. Thank you, Laila. So Laila, we can start with you, okay?
والله اوكي ماشي.
Yeah, definitely.
والله أنا مش كنت أتكلم. اوكي يلا. بس is there drug therapy problem ولا هي checked by doctor by pharmacist ready for pickup؟
ما حدش عارف حاجة.
It is counseling. It is counseling. It is counseling. Yes. Yes. Okay.
Okay.
Okay. So okay. Hi.
Excuse me. Have you Mia? Have you checked the reference?
Okay.
Have you got the time to check the reference?
Did you check the reference, my dear?
Yeah, I did. Yeah.
Did? Okay.
Okay.
Okay. Okay, Laila. I'm gonna start with you. Okay.
Yeah.
Oh, okay.
Okay. Hello. May I speak to the pharmacist, please?
Yes, my name is Laila, the pharmacist in duty. How may I help you?
I'm here to pick up a medication that's already made.
Okay.
I told you guys two hours ago, and my doctor sent a prescription for my son. So I'm here to pick it up.
Okay. What is the name of your son, please?
Justin Trudeau.
And his age?
6 years old.
Okay. Of course, I can help you with that. Would you mind to have a seat in our private confidential area, please?
I don't mind.
Okay. So why did you see your doctor for Justin today?
Yeah, we went for the doctor in the morning, and he sent it faxed it to you guys. And
okay.
he gave antibiotic, I believe, for ear infection.
For the ear infection. I'm sorry to hear that. Must be bothering for him and for you guys. So, did the doctor tell you anything about the medication other than it's antibiotic?
No, he told me that the patient, the pharmacist will explain to me how I am going to use it.
Okay. Would you mind going through his Justin medical condition first to make sure the appropriateness of the medication?
Yeah, no problem.
Does Justin has any medical condition other than his ear infection?
No, he's healthy.
Is he taking any prescribed medication?
No.
Any over-the-counter medication?
No.
Vitamins or herbals?
No.
Okay, and he is normally active child?
Yes, he usually go to his swimming classes and stuff. Yeah, he's very active.
That's perfect. Can I know the weight of Justin?
It's written in his file, I believe.
Yeah, I have. Yeah, is it updated? The last weight is 18.
Exactly. Yeah, 18.
Okay, I have like he has 3 allergies: peanut, sulfur, cephalexin. Is there any update?
There is no changes. No.
No change. Okay, let me check my reference, please, and come back to you. Thank you.
Okay.
Okay.
Yes, Justin doctors prescribe him antibiotic called the clavulanic, which is contain amoxicillin and clavulanic acid, which will help him in his ear infection by killing the bacteria. The doctor want you to give him 10.1 ml twice daily every 12 hours. And this will continue for 14 days, for 2 weeks. Okay, and you may start experiencing some improvement within 2 days, but you should complete his medication till the end of the course. It may be taken with or without food, it doesn't matter. But if he experiences any diarrhea or upset stomach, you can give him the medication with food. If at any point you notice any rash all over the body, any swelling of the tongue, Justin may be allergic to this medication. Please don't give him any other doses and rush to the emergency. For this medication should be kept in the fridge, and the suspension only is stable for 7 days. So I'm gonna give you the first 7 days supply, and when you run out of the when you finish the first 2 days, first 7 days, you will come to take the other bottle.
Or you giving me the 2 bottles. Actually, the guy told me that he's giving me the 2 bottles.
Yes, this medication actually is stable only for 7 days. So I'm gonna give you 1 bottle, and you can come off, or we can deliver the other bottle in 7 days. Sounds logic for you?
Sounds logic for me.
Okay. Do you have any questions so far?
No. Thank you so much.
Thank you, and have a good day.
2 minutes remaining.
اوكي طيب ما بس خلاص مش عارفه اقول نون فار.
قولي نون فارم يا ستي، ايه المشكله يعني؟ قولي
لسه عندي 2 minutes. Does Justin has any fever or not?
No fever. It's just recurrent ear infection because of the swimming classes.
Okay. Did his vaccination is up to date?
It's up to date, yes.
Okay, since he has an infection because he is a swimmer, so during this that duration of treatment, please avoid going to the swimming course or swimming classes. And after the treatment is done, there is some non-farm to keep his air dry as much as you can. So by using air plugs or drying it by air dryer on low setting, and yeah, does it make sense?
I will use ear plugs better. Yes.
Okay, that's perfect. And that's it. Do you have any other question or concern?
Yes. Are you going to follow up with me?
Of course, I call you. I will call you in 2 or 3 days to see how it works, if the drug, the medication works with Justin. Are you okay with that?
Yes, definitely. Please do. Thank you so much.
Okay, thank you. Have a great day.
Laila, you did that. You got it. That's good. Continue, because you have time and you have a chance to get more points. So continue with the non-farm. Continue. Why you stopped? You got the main point here. The Claveline, the bottle after the
reconstitution, it's only for 7 days.
It's only good for 7 days. So and the full dose has to be for 2 bottles. So you're gonna give her the first bottle. When she's finished, come back after a week, get the second bottle. Okay, then after that, go for you solve it. Go for more extra information, like follow up. Do like non-farm and stuff like that, and it's fully solved this way. Okay.
أنا بتوتر.
Don't you got it actually. No need to.
No.
Yeah, totally fine. And I like.
Are you working in a pharmacy?
No.
You work in a pharmacy? Yeah, that's why. Exactly. That's why. Yes, people who got it, people who work in a pharmacy. People who doesn't work in a pharmacy much may feel some difficulty to catch the main point here. Yeah, no problem. Okay, thank you for your contribution. It's really nice. Seriously.
شكرا يا دكتور. شكرا.
Just to be confident, because it's a simple thing for you actually, and I like the way of communication. When you give me an advice, you ask me, is it good for you? Is it reasonable for you? That's very good, by the way. You're not just dictating points to me. You're asking my opinion about your advice, which makes sense to me, which is really thankful. Yeah.
شكرا يا دكتور. ألف شكر.
Have you mentioned anything about the side effect?
أنا قلت diarrhea وقلت الأنافيلاكتيك وقلت
Yes, she
upset
said about the area. Yes, she asked. Yes, she did. She did.
Okay, good. تمام. بس انت اديت الجرعه مظبوطه، حسبت الجرعه صح، انت قلتي 10 او شويه مش كده؟
10.1 ml صح؟
Yes,
مرتين.
yes.
هو بيبقى في كالكوليتر في الامتحان؟
حاجه محتاجه كالكوليتر
Okay, what was Mehan? Mehan?
Mian, yeah.
Yeah, sorry about that, Maria. So, did you got the point here?
Oh yeah, yes, I did, yeah.
Yes. So here the main point is to give one bottle only and let her come back after 7 days, because the medication expires after 7 days. Okay.
It's a new station, I believe, guys.
Yeah.
All the stations are new actually, but this one is like, it's a very new one.
Very new to our practice actually. It's an everyday practice. It's an everyday practice. It happens. Yeah, but new to our course, yani. I hope that we are done for today actually. If someone has any concern or any question or any comment, please shoot it. I hope this was beneficial for everyone. Now we covered the first skill, which is counseling. Okay, so the main issue in counseling, the 4 points that Mohammed told you about, indication, efficacy, safety, okay, and adherence. You have to check on those points. You have to or you must to dispense medication. As long as it's called counseling, no referral. It has to be dispensed.
I have a question only for the last case. Why Laila doesn't ask about the type of reaction for peanut and sulfa and cephalexin?
Why Laila does not? I don't know. Maybe it's a missing information about it. However, she should ask. That's totally right. If it's like
so whatever allergy, I have to ask about that type of reaction.
Definitely yes. If it's like type 1, it's a red flag. If it's type 2, we can
we can monitor.
Yeah, exactly. Yeah.
Okay,
yeah.
Do we need to offer EpiPen?
Here, okay, wait a second. Here, Shams is saying you may counsel on a chemo or HIV drug. Totally right. However, if you counsel on a chemo or an HIV or on any or type 1 diabetes or any autoimmune disease person, do not forget to make sure that you ask about that the vaccines are up to date. Okay, if there is any interaction, advise the patient how to maneuver the interaction, or taking any kind of it's affecting the CYP enzymes, most of the HIV drugs, right? So make sure that you tackle this point as well. Counseling is counseling everywhere. However, there is some minute here, like changes here and there, that it depends on the medication or the situation itself. Okay. Give 10 ml is the answer? No, 10 ml is not the answer. Giving one bottle only is the answer, and the other bottle has to be reconstituted after a week.
Yeah, no, I think she's asking about the dose. Yes, those maybe 11 or 10 something. You can calculate it, yes.
You're asking about the dosing. Okay, guys. Any question, guys? I hope it was beneficial for everyone.
Yes.
And it added something.
By the way, in the exams, الامتحان ممكن يبقى سهل بالشكل ده، يعني هو الستيشنز برضو ما كانتش سهلة يعني إلى حد ما. عموما احنا كنا بندي ستيشن صعبة، بس انتوا يعني ما قلتوا احنا المهم هنا ان احنا نعرف الكونسلنج. اوكي، الكونسبت بتاع الكونسلنج وازاي ندي الكونسلنج والستبس وهكذا والاسسمنت بالذات. تمام. الستيشنز في الامتحان على فكرة ممكن امتحان بيبقى سهل جدا وفي امتحان بيبقى صعب، انت وحظك يعني. في كام امتحان كده، الناس اللي امتحنت قبل كده غير نوفمبر اللي فات ده اللي قبل كده في امتحانين 3 جم كانوا سهلين جدا لأغلب الناس. اوكي، امتحان نوفمبر ده لحد ما كانش سهل بصراحة، يعني ما كانش سهل، كان صعب شوية. اوكي، فعشان كده انت وحظك يعني. فالموضوع ده اهم حاجة بس انك تبقى جاهز، بتبقى fully equipped بالسكيلز والبريباريشنز بتاعتك، وبعد كده بتبقى خلاص يعني. تمام. اوكي ماشي يا
My
شباب.
advice, يعني my advice is
Yeah.
to have find a partner, and like every day you have to practice like crazy every day. So the scheme of the SOS scheme that we discussed before is like easy and simply processing in your mind in every situation or every case. Okay, and try to tackle as much ideas as you can. I believe everybody knows